at Goa Institute of Management. On behalf of the faculty, staff and students, to our distinguished guests, esteemed speakers and all the attendees who have joined us today. Your presence today is a testament to your commitment to shaping the future of healthcare, particularly as we explore the theme of the conclave, Future of Healthcare, Bridging Divergence Through Disruptions.
Before we begin, I would like to invite the Director of Goa Institute of Management, Professor Ajit Parulekar, Professor Ajay Vamadevan, the Program Chair for Healthcare of Management, and Mr. Anjay Bose on the stage for the ceremonial lighting of the lamp, marking the formal inauguration of our event. I would also request Amir Shah, please make it on the stage.
You could do with some claps. And you could do with some claps the entire day.
For lighting? Professor Arif, I would please invite you on the stage for the lamp lighting as well.
You can also invite both our speakers.
Now I would request all the dignitaries to please join us on the stage for a group photograph. Can all the dignitaries please join on stage?
Group photo for the finalists.
To get everyone's attention at the science. इसके बाद बस थोड़ा वॉल्यूम कम करना है, थोड़ा तेज हो गया था थोड़ा सा, but it was we needed that. शॉन सर क्यों नहीं आ रही? यहाँ क्या मैम प्रवीण सर doesn't matter, I'll invite you, sir. At a time when the world is witnessing rapid advancements in technology and their profound impact on healthcare, today's Healthcare Management Conclave is an opportunity to collectively explore the roles each of us can play in making healthcare more inclusive, accessible, and sustainable. Our discussions today will help us identify pathways to bridge the gaps that exist in healthcare delivery and harness the potential of innovations for the greater good. Now I would like to invite Professor Ajay Vamadevan, the convener of today's conclave, to deliver the welcome address.
A very good morning to you, all of you. It is an absolute honor and privilege to welcome you to the 5th Annual Healthcare Management Conclave, centered around the theme, Future of Healthcare, Bridging Divergence Through Disruptions. This event is organized by the Faculty of Healthcare Management at the Goa Institute of Management. I would like to begin by providing an overview of our healthcare management program, which was founded a decade ago by our visionary director, Professor Ajit Parulekar. Our HCM program is India's pioneering initiative in healthcare management, specifically designed to cater to the unique needs of the healthcare industry. It stands as a testament to academic excellence with a 100% placement rate for graduates. We are proud to be recognized as one of the top healthcare management programs in the country. The HCM faculty not only groom future leaders, but also contribute to evidence-based policy development through faculty-led research and consultancy services within the industry. This year's theme of the Healthcare Management Conclave reflects the monumental shift occurring in healthcare, driven by disruptive innovations that are transforming the way we approach healthcare and paving the way for a future where traditional and modern practices converge to create a more holistic and accessible healthcare system. As we embark on today's discussion, let us take a moment to acknowledge the remarkable journey of our previous conclaves, each of which has set a precedent for in-depth analysis and transformative dialogue. Our first annual Healthcare Management Conclave in 2018 focused on Ayushman Bharat and its implications for universal healthcare, bringing critical national policies to the forefront of our discussion. The second conclave in 2020 delved into the theme, accelerating and sustaining investments for financing India's healthcare needs, highlighting the financial mechanisms necessary to strengthen healthcare. The third conclave in 2022 explored futures thinking in Indian healthcare, prompting us to anticipate and prepare for emerging healthcare challenges. Last year at the fourth conclave, we examined digital metamorphosis in healthcare, focusing on immense potential of digital transformation in healthcare delivery, patient care, and health research. These past events have had tangible outcomes. They have guided and contributed to our healthcare management curriculum, strengthened our student placements, expanded our industry connections, and contributed to research and grant applications. Today, we continue that legacy of impact as we dive into the disruptive innovations shaping the future of healthcare. This year's theme, Future of Healthcare, Bridging Divergence Through Disruptions, is particularly relevant as healthcare is being reshaped by cutting-edge technologies such as artificial intelligence and machine learning. Similarly, the startup ecosystem too play a pivotal role in healthcare disruptions. These startup ventures are leading the way. Innovative solutions such as digital health platforms, wearable devices, and telemedicine services, all of which are transforming how healthcare is accessed and delivered. Alongside these transformative changes, we are also witnessing a significant integration of Ayush, particularly the traditional Ayurveda practices, into modern medicine, a convergence that signifies a shift towards holistic health. Today's conclave brings together leaders and experts from the industry, the academia, to deliberate on the constructive role they can play in managing and navigating the disruption that these innovations brings to healthcare. By working together collaboratively, we can meet the goals of the universal healthcare, optimizing healthcare delivery and outcomes for 1.4 billion citizens of India. On behalf of the Goa Institute of Management, I extend a warm welcome to all our distinguished speakers who have graciously taken time out of their busy schedules to join us for this conclave. We are honored to host esteemed representatives from the academia, industry, research community, including esteemed colleagues from the Goan academic institutions, the Goa Chamber of Commerce, Directorate of Health Services, and many distinguished doctors and healthcare professionals. Your presence today will enrich our dialogue and reinforce the spirit of collaboration that is vital for the future of healthcare. I would also like to welcome our faculty colleagues and students whose dedication and hard work has been instrumental in organizing this event. As we proceed with discussions today, let us remember that we are not merely exploring the future of healthcare, but are actively shaping it. The ideas and insights shared here will help bridge gaps in healthcare by uniting diverse approaches, fostering new research ideas, strengthening industry academic partnerships, enhancing healthcare management education. Thank you, and I wish everyone a productive and insightful day ahead. Thank you.
Thank you, sir. Now I take immense pleasure in introducing our director, Professor Ajit Parulekar, sir. Dr. Parulekar is an accomplished academician renowned for his extensive experience in the corporate and academic realm. With a diverse background in brand management within the pharmaceutical industry, Dr. Parulekar brings a unique perspective and has played a pivotal role in the success of Goa Institute of Management. Beyond his academic endeavor, Dr. Parulekar has... Okay. Yes. I invite Ajit sir on the stage to deliver the keynote address.
Yeah, good morning to everyone. Why don't we start by giving, showing our recognition to all these distinguished speakers who've come here, taken time off from their busy schedules, and who are going to give us a scintillating day. So why don't we start by giving them a very big, loud round of welcome. Thank you. So we've been doing an annual conclave in healthcare. Started, I think, 6 years back. You can understand that we missed 1 year in between during COVID. It didn't make sense to do these, the COVID year, I think, was probably the only year that we didn't do one. Immediately after that, we still did one online. Therefore, we are very happy to bring to you the 5th in an ongoing series of conversations. And we think these conversations are extremely important. For us, more so because we see future leadership in healthcare is sitting in this room who's going to listen to these conversations, and it will make a deep impact, we think, on the way that they are going to, it's going to shape their trajectories, their thought processes, the way that they are going to look at opportunities in the industry, and kind of their worldview on what happens in this industry. Students who come into our healthcare management program specifically, they come from a diverse background. Around half of them will come with a background with an undergraduate education related to healthcare. Could be in medicine, could be in Ayush, could be in pharmacy, dentistry, biotechnology, biomed, and things like that. And half of them come from diverse backgrounds, including backgrounds, not so many of them will come with a technology background, but we don't have background as a prerequisite. So you could have somebody who comes from a background in arts and literature. And the 11 years that we've been running this program, people, irrespective of the background they come from, they seem to be doing well in the healthcare industry. Yeah, so I do think that diversity, it's one of the founding principles for the institute. Diversity adds to a much more richer learning experience. Similarly, our faculty come from a diverse background. We have a reasonably large faculty. I mean, the GIM fraternity knows this, but since we have experts coming from different industries, we have around 90 full-time faculty. They come across different domains and disciplines, and roughly around a dozen faculty who are specialists in healthcare, coming from areas that you typically don't see in traditional business schools. Public health is one of them, how hospitals are run is another one, and of course, the traditional areas too, where you will see health economics, healthcare financing, health systems, operations management, marketing, people with experience in pharmaceuticals, diagnostics, medical devices, and things too. We are quite active not only in terms of the program that we run, and it's today, in a decade's time, we're clearly amongst the best healthcare management programs in the country, but our faculty also do a lot of work in health systems in the country. So, some of the work that they've done, so they've done a lot of work with organizations like WHO, USAID, a lot of course, academic organizations in different parts of the world, largely working in health systems, something that that our country requires. In parallel, because we're having a conversation today on technology as well as a conversation on startups, we also established in the first round of Atal Incubation Centers, GIM was chosen as one of those places where an Atal Incubation Center will be set up, and we've been running it now, I think, since 2017 onwards, is 17 or 18 onwards when we set this up. It's not a health tech startup incubator only. Being a business school that runs across different domains, we are sector agnostic. Of course, we do have some interesting startups in the health space. As part of when I'm supposed to give a keynote, I must just tell you that in parallel over the last 3 days, we have 4 different events happening. So I've been giving keynotes from people who are dealers for petroleum companies to yesterday future of work in healthcare, not in healthcare, in HR, and today to do with healthcare. Of course, I'm passionate about healthcare because I spent a sizable amount of time in the health industry, and therefore I thought this is a keynote that's closer to heart. Of course, because this is not something I'm doing actively, so I'm not as active a researcher now or a teacher, and therefore when I decided, let me look up what's latest on the conversation there. And I keep doing this every couple of months, and it's an extremely exciting space. What you saw a couple of months later, technology has made so many new things possible. And therefore the same stuff that you look at. I remember 4 or 5 years back, there's this popular app called Healthify Me. And I had a Healthify Me, and now, I was not disciplined enough to use Healthify Me. So today I find it so much easier, because now you don't need to input data. You can take a snap, and it's going to calculate stuff, right? And just like I'm taking an example here, I think it's across every industry, and of course, healthcare is something where technology is driving a lot of things in healthcare. So when I was thinking about, what is it that this technology is driving? So one of my early conclusions on this is that, I work across, I'm basically a marketing and branding guy who works across different industries and sectors. One thing that I've seen is, till something like 25, 30 years back, most of the advances in sectors were sector specific. So if you had to pick up automobiles, you had people who were working really on, injection systems, they were working on, fuel management systems, on braking, on everything that was essential to automobile. And if I can think of, the latest developments in automobiles per se, I think they're more than a decade old. Power systems and, injection systems and, stuff like that. Most of the advancements that have come from technologies that cut across different industries. So today, if you look at the differentiator between one automobile and another automobile, it's really electronics. The difference is not that it's primarily electronics, and what was electronics, and now you have AI-enabled electronics, which do so much more stuff. I know why am I talking about automobiles. Just like automobiles, about just about any sector you take, and that's really what's happening, including medicine. There are, of course, advances that are happening in certain pockets. I know that, when I went to pharmacy school, personalized medicine was like a pipe dream, looked nice, but, it was just like time travel. Personalized medicine looked as remote as that. And today now you find that if I say to anybody that personalized medicine, you know it's a reality. You know it's a reality because all the underlying technologies that you required in terms of data, in terms of the regularity of data that you would get. So I'm sure many of you will have devices that is able to capture health data, and that's real-time data. And every year you find that the quality of data that's coming and the accuracy is significantly better. Now you take that data, you combine AI to it, and you combine variety of other technologies. I'm not saying only AI. There is, on genetics, there is sizable amount of work that's happening, and on biosimilars, there's a lot of work happening. On robotics, there's a lot of work happening. On 3D kind of computing, there's a lot of stuff happening. When all of these get combined and the data gets fed in, you suddenly find that things that you thought were, fantasy seems to be coming as reality. No wonder, therefore, that you're going to find conversations now around healthcare are becoming central to even elections, something that never happened in India, despite the fact that we still don't spend 8 and 10% of our GDP on healthcare. We still are relatively conjunced there, and we still have a very small percentage. Otherwise, usually what you find is where the money goes is where the conversations start, right? But today you really find that healthcare is now a central topic in elections across the country. And that's because there's a lot of revolutionary stuff that's happening there. We have leaders coming from, different parts of this, of this large diversified industry. And we will be able to hear a lot more about nuances, nitty-gritty, hopefully some internal stuff that's not yet out in the public domain. And I'm sure that's going to make a lot of difference to the conversation then subsequently you will have in classroom with your faculty, the kind of projects you're going to take up, research conversations that our faculty will have with other people outside. And therefore, I'm really excited about looking at each of these three, panel discussions that we're having on AI/ML and, the impact that AI/ML is going to have. The second is, of course, on startups. And the third part is Ayush. I must admit that though we've completed a decade, that's an area that we've not done much. I must say, I'm quite ashamed that we've not done much, but I do think that that's a place that we should. There are so many questions that allopathic medicine doesn't have answers to. And I think we have such a lot of tradition and wealth of knowledge there. I think if that's something that gets combined with technology, you have infinite number of possibilities coming there. Not thanks to us, but you just find that yoga has become like a major global phenomena. Let that not happen to rest of Ayush. I think, leading organizations like us, leading academic organizations like us, have to take this and mainstream it into all our conversations, into whatever we do. And therefore, I'm looking forward to not just the conversations that we're going to have today, but also looking at potential relationships that we can have with, with different providers, different academic institutions, different, thinkers in that space. So that's something that I can commit that over the next couple of years, you will see a lot more integration. It'll probably start small with maybe a course or subject coming in there. But we do think that it'll be, that's just going to be, so to say, a token, a course. But we'd like to integrate it into everything that we do. Yeah. We also work closely with the government of Goa and with variety of different organizations in Goa. And I'm glad to see that there are people coming from different organizations in Goa, because I think it's important. There are many places where, for those of you who don't know, Goa does extremely well on most of the health outcome indicators. It would usually be in the top 3. There are spaces where Goa still needs to catch up. There still are certain, I won't talk about it here, but there are certain, certain health concerns that Goa has where we are not doing as well. And that's a place where, we could do work. The other places, Goa is not yet, I think, a leader in terms of data. And that, I think, for a small state, we have the opportunity of being like a pilot case for any other state in the country. Our total population is 1.5 million. The per capita income of Goa, I mean GDP per capita in Goa is roughly 3.5 times what the national GDP per capita is. It competes only with Sikkim as the richest, territory of the country. So you have the money. As a result, you have the education. You already have reasonably good health status. You're relatively small, and therefore geographically all small, and also in terms of people. And therefore, I think that's a great place to pilot, to build models, and then wherever it's applicable to kind of transform and test out those models in other places. I think that's something that we can do. With that, welcome once again, to all our speakers, to all our students, faculty, guests who've come from industry, government, academia. Welcome once again to Goa Institute of Management, and look forward to a scintillating day of conversation. Thank you.
We will now proceed with the tea break. Everybody is requested to be back at the auditorium by 11:30 a.m. Thank you.
आप इसको ऑन ही दिस इज ओनली थिंग दिस इज ऑन हेलो
Hello, Mr. Giri, can you hear us? Can we make the announcement from there? Yes, we have to check whether Mr. Giri can hear us. He's online, yeah. Yes. He's writing something, right? Host has to
Okay,
unmute
now-
me. You have to
Yeah, can you
unmute.
hear me?
Hello?
Yeah, can you hear me?
Yes, yes. Good morning. We'll just start in 2 minutes.
Okay, no problem.
So I'll just wait.
I think I'll just ask this. So shall we wait for you because they will start introducing it. Take. Surupa, he's joining just now. क्या बोलता है?
Welcome back, everyone. I would request everybody to be seated. We now resume with our event. Now, I would like to introduce Professor Shrirupa Sengupta, the co-convener of today's conclave. Dr. Shrirupa Sengupta is an associate professor in healthcare management of the Goa Institute of Management. Her teaching and research focus on health, public policy, gender, and development. She has been awarded research grants from organizations such as UN Women, UNICEF, the German Institute of Development and Sustainability, and the Ministry of Women and Child Development for her work on health, health communication, gender, and health and human rights. Dr. Shrirupa brings over 15 years of experience spanning various industries, non-governmental organizations, and academia. She holds a PhD in gender studies from Jadavpur University and a master's degree in sociology from the Delhi School of Economics. She is also an alumna from the German Institute of Development and Sustainability. And I will invite Shrirupa ma'am on the stage to introduce us with the panel.
Good morning, everyone, and welcome to the first panel of the day. Our first panel is on artificial intelligence and machine learning, charting the future, how AI and ML are reshaping healthcare. Before I introduce all our esteemed speakers for the panel and the moderator, I invite all the speakers for the panel and the moderator on the podium. Please welcome all the speakers with a round of applause. We have 5 distinguished panelists joining us, along with Mr. Anjan Bose, who's our moderator, our favorite Anjanda. Two of the speakers, Mr. Giri and Dr. Rajiv Singhal, has joined us virtually. I would now take a bit of your time to introduce all our esteemed speakers. I start with Mr. Giri, who's our first speaker for the panel. Mr. Giri has over 3 decades of professional experience. He's currently the president of ExperienceFlow.ai. Welcome, Mr. Giri Atuluru, to our panel. I hope you can hear us, sir.
Yes.
Mr. Giri began his professional career with Infosys in 1995, and after that he has built and led many of products in optical, ATM and frame relay switching, and he has built successful startups that went public like Sycamore Networks and Cascade Communications. He's been the founding engineer for top-tier venture-funded startup like Divitas Network, which is a leader in phones. Mr. Giri is the founder of ExperienceFlow.ai, which is a pioneer in artificial general intelligence for enterprises. Some of his key achievements are he holds several patents on seamless roaming and complex decision-making systems. He is a graduate from IIT Kanpur with a major in metallurgy and material sciences and a minor in finite mathematics. He's also studied entrepreneurship and finance from the Harvard Extension School. A big round of applause to Mr. Giri.
And it's 1 in the morning in US where we're speaking from.
Our second esteemed speaker is Dr. Rajiv Singhal. He's the managing director and group CEO of Meringo Asia Hospitals. Dr. Rajiv Singhal has also been the group CEO of Care Hospitals and the group CEO of Sakra World Hospital, Bangalore. He has also been the regional director of Fortis Healthcare and the medical director of Aditya Birla Hospitals. He holds independent director position on the board of Apollo Dhaka and is a board member at Care Hospital since 2016. He's also a board member at the JMH Durban. Dr. Rajiv Singhal has several other highlights which I would like to highlight. He has played an instrumental role in setting up the first e-ICU concept in India with over 150 beds which are connected over 5 cities, for which he was awarded by the governor of Karnataka.
Recording in progress.
He has also played a pivotal role in turnaround of Fortis Escorts and also been engaged, and he's been an awarded 12 times and holds number of awards and accreditations. He's being awarded as the Health Leader of the Year, Innovation in Healthcare, and also currently the co-chair for Medical Value Travel at FICCI and the co-chair for Northern Region Healthcare at Nat Health. Please join me in welcoming Dr. Rajiv Singhal. He's joined online. He's a graduate and a postgraduate in Armed Forces Medical College, Pune, and an alumnus of IIM Ahmedabad. Moving on is our third esteemed panelist, Dhruv Sukrani, who leads the India Healthcare and Life Sciences practice for Bain. He has more than 15 years of experience in management consulting across North America, India, Middle East, working across providers, pharma, medtech, and health tech. He spends his time working with the industry leaders on the most pressing issues around strategy, growth, and use of technology, data to build competitive advantage. He's also authored Bain's annual publication, Frontline in Healthcare, which tracks how the healthcare space is evolving from the customer lens, focusing on their attitudes towards preventive use of digital channels, openness to use of AI, among other topics. A big welcome to Mr. Dhruv Sukrani, partner, Bain and Company. The other stellar guest and speaker on the panel is Mr. Kalyan Sivasailam, the founder and CEO of 5C Network, which is India's preeminent deep tech startup in the health space. 5C has the world's largest and fastest growing library of AI models on radiology and has been recognized in various fora for their achievements and has been backed by leading venture capitalists from India, US, and South Korea. Mr. Kalyan has a degree in computer science from the prestigious National Institute of Technology, Surathkal, a postgraduate diploma in intellectual property rights law from the National Law School of India, University, Bangalore. Mr. Kalyan has been recognized for his work by being an honorary and listee in the prestigious Forbes 30 Under 30 list for India and Asia. Prior to founding 5C Network, Kalyan led the Healthizen initiative for the government of Karnataka that promoted preventive healthcare through community participation and civic authority action. During this time, Kalyan was awarded as a Hindustan Times Young Social Innovator. We are very happy to have you, Mr. Kalyan, as a speaker in the panel.
What shall you do after 30?
The last speaker and our last esteemed speaker on the panel is Mr. Nakul Jain, who's the Director of Solutions, Vadwani Institute for Artificial Intelligence. Mr. Nakul Jain is passionate about leveraging artificial intelligence to drive positive change and improve the socioeconomic conditions of people. He has 13 years of expertise in digital transformation consulting and currently directs the full spectrum of product offerings encompassing health, agriculture, and education at Vadwani Institute for Artificial Intelligence. Nakul is proficient in product management, marketing communication, stakeholder management, holds an MBA and BTech in electronics and communication engineering, which equips him to drive operations, delivery, and growth strategies for impactful solutions in solution contexts. Welcome, Mr. Nakul Jain. And finally, Mr. Anjan Bose, our own Anjan Da, who is going to moderate this esteemed panel. Mr. Anjan Bose has been the former founding Secretary General of NatHealth, which is the Healthcare Foundation of India. He's been a former president of Philips Healthcare and Consumer Lifestyle India and South Asia. He has held several other distinguished leadership positions, such as being the former Asia Pacific Vice President of Emerging Markets and Financial Programs at Hewlett-Packard Medical Products Group, being a Vice President and head of South Asia and India Hewlett-Packard Medical Products Group, being a Regional Manager of South Asia and India of Philips Medical Headquarters in Holland, former Managing Director of Detex Omeda India, former Chairman CIA's Medical Equipment Division, former Founding Chairman of FICCI's Medical Equipment Forum, and Chairman of FICCI's National Healthcare Services Committee. Besides, Mr. Bose is also an advisory, holds advisory and mentoring roles for FICCI, Tata Medical Diagnostics, Experience Flow, Praxis Global Alliance, India Accelerator for Startups, and of course he's an advisor for Goa Institute of Management. A big round of applause for all our panelists and for Anjan. Over to you, Anjan.
Thank you, Shirupa. You can see from the last few seconds of Shirupa, who is the youngest in this panel, guys. So, first of all, you all look very somber and serious. This is not about a serious subject, but let's sort of have a conversation where you are also participating. Okay? Okay? You're all awake? Okay. So we'll keep you engaged, and we'll do our best. Now, the theme of the conference is anyone? Theme of the conference? Future of healthcare. We are talking future here, science fiction stuff. Okay, that's the first thing. It's great fun going to be. So enjoy this conversation amongst eminent leaders of the industry in that perspective. Bridging divergence through disruptions. Two key words. And for healthcare, HCM, you leaders who are going to be in the market, in the industry very soon, as healthcare management leaders, is very important two words. I have, of course, I have managed other businesses in organizations like Philips, but healthcare is a passion because of number of reasons, okay? And I'll come to this divergence and disruptions. Divergence, you heard Professor Ajit, your director, give a very excellent keynote address, and he brought this point out. And today you have in the panel AI/ML, and you have in between startup, and then you have got Ayush. How diverse, healthcare is today. I think this selection of the topics by GYM management, HCM management, shows and confirms how diverse it is. At the end of supply chain in any industry, there is something coming out, right? And a car or a mobile phone or a sack of cement or whatever. What is at the end of value chain in healthcare? I'm not using supply chain. Yes? It's a patient, right, Kalyan? You know, this is the only, I searched a lot. Is there any other so-called business sector which has got the word care in their names? I couldn't find any. So I am giving this to you students who are going to launch yourself, your career in healthcare sector. It's a wonderful sector to be in, but at the end of the day, although we'll do business around healthcare like health tech or hospitals, there is a living human being in agony that needs to be healed, surrounded by, in a hospital or home care situation or other situations, surrounded by anxious friends and relatives. I've always kept this as a leader in front of me while taking any decision or guiding my team. You, the leaders of healthcare, that's my only sermon to you, if I may say, keep that in mind. It's not business alone, it's healthcare. And that's what makes it fun. I know at least a couple of panelists in this esteemed panel who came to healthcare because of their personal, emotional reasons. And I think that's the biggest driver, emotion and passion, to get the best out of you. I feel tempted to mention one name. I mean, that's when the best technology, the best leadership comes out from you. So this is one thing I wanted to mention in the start, just to kick this off. Now, what is this much discussed animal called AI, artificial intelligence? We are surrounded by AI for the last half a decade at least. We are surrounded by all kinds of, all of you know Alexa? So everyone knows Alexa today. I didn't know what Alexa is. My son told me a few years back. And you know Siri? Lesser known, but you know Alexa is more popular. That's AI for you. You have the possibility of relaxing on your sofa, and simple examples I'm giving, and you know, putting an alarm to catch next morning flight through AI. Okay, so AI has seeped into our lives both personally and professionally in the last, I would say, 5-7 years, and now more intensely. Now, just 10-20 years back, it was science fiction stuff. So we will discuss, I'd like to know from our esteemed panelists, why this migration, this excitement, yeah, about AI, you know, in the last few years. Because if, you know, even in a sector like healthcare, which concerns, as I said in the beginning, people's life, we have to be very careful. So there is a pros and cons involved here. It's complex, it's future, it's not yet fully understood, it's work in progress, but we want to use it with complete safety and quality of the ultimate recipient of healthcare, that is patients, in mind. These are some guiding sort of filters I'm giving for discussion here. And in spite of the complexity, why it is getting, you know, making all of us so excited. Today, already in the last couple of years, Kalyan and Nakul, you would be knowing AI is everywhere. Your imaging, the work that we'll hear from you, the Wadhwani, public sector, private sector, you know, I think AI is here to stay. And for leaders, for all of you, it's possibly most important to know that new set of skill sets will be needed, new mindset will be needed from bottom to top. CEOs must change their mindset to accept this reality. And it's exciting. Now, some of the domains of AI, just short ones, you know, like machine learning, deep learning, fuzzy logic, and expert and, you know, natural language processing sounds like ChatGPT. I tell Giri sometimes when we discuss that, you know, I find ChatGPT possibly is a frivolous version of what he will talk about a digital nervous system, the professional one, especially in healthcare. So I will now sort of start with some bullet point topics for each of you. And before that, I would like to quote the eminent Chinese philosopher Confucius. Confucius said, life is simple actually. Life is really simple. It is we who have the tendency to make it complicated. And this came to my mind, you know, in the morning when I was taking a drive. We didn't have any AI 5 years back, 10 years back. but we also didn't have any positron emission tomography 15 years back. So the message to you all, future leaders of healthcare, it is future of healthcare, you are future of healthcare, and you need to adapt to the very rapidly, I won't even say changing, I won't say transforming, it is metamorphosis is happening, and you have to run dynamically with that. How exciting is that? You find it exciting? Yes. It's exciting. It's a bit daunting, but that's what makes life exciting. I mean, we are from the days I was telling Kalyan is imaging, X-ray, I started after IIT, the first job was on a simple X-ray machine. It's still there, but you have ultrasound and nuclear medicine and CT scanner and MRI and protons and whatnot. Similarly, now I think we have to change our mindset because AI is not tangible. You can still touch an MRI, you can't touch an AI. This is the most important thing, but it exists. Science fiction stuff, daily you will face, and it will be exciting leadership opportunity for you. So Confucius was right. I think we love to have the excitement of making our lives complicated, but there must be a reason for it. So let's find out what are the reasons. Why we accept such complication in our life? What is the potential and possibility of AI in healthcare? I have some bullet points which I've shared with all of you, and also, Giri and Rajiv, can you hear me? Thank you.
Yes.
Okay, Rajiv, I want to say two bit about these two very eminent speakers. In addition to what Shrirupa mentioned, Professor Shrirupa, Giri, I also like, I'm very fond of your director Ajit and the entire team here. I'm very fond of Giri, and these two are my top in the advisory list because of the kind of people that I live with in these organizations and because of the excitement that it gives. So Giri is right now in central US. It's past 1 o'clock, Giri? I guess? Yes, it's past 1 o'clock.
Yes.
Yeah, and 1 o'clock in the morning, not afternoon. And that's the commitment. He agreed to our invitation to be with the students to talk about from Silicon Valley what's happening in AI. So thank you, I appreciate that. Dr. Rajiv Singhal, whom I admire and respect, Marengo has come in a record-breaking time as one of the top of the absolutely top healthcare delivery system. And what you have done, Rajiv, with your vast experience as a surgeon, ex-army, care hospital, everything that we heard about, I really admire as a veteran in the healthcare. So you won't find a better founder and CEO and at the helm of affairs of a growing healthcare delivery system at a rapid rate. So thank you. I know you had an emergency. Thank you for joining. Really appreciate that. First arrow, and I won't do it in a question answer. Please tell whatever you have to say, in the time that we have got till 12:45. I guess since lunch is after that, if it is exciting, the students will forgive us if we go by 5 minutes extra or something like that. So, I'll start with you, Kalyan and Giri, with the medical imaging point. AI algorithms assist in diagnosing diseases from all images, X-ray, CT scanners, MRI, etc. So, you focused on that. Why? And what's your experience, all these years till 30, Yeah. So, Kalyan and Giri, I'll come to you on the same thing because I know you work a lot on algorithms. Please, let's make it crisp, focused, and exciting.
So, radiology is an exciting space for two reasons in the AI space. One is that radiology data is already digital. Unlike most other forms of healthcare data, radiology data is standardized in the DICOM format and is completely digital. The second, and I would say equally important point about all this is that the radiology and medical imaging space connects 85% of moderate to severe illness. So if anybody has a moderate to severe illness, they are definitely going through radiology. Okay. So if you want to build in the healthcare space and you want to build using data, radiology, medical imaging is the perfect entry point because you have standardized data through DICOM, digital data, and of course you have massive scope of disease, literally head to toe, and anything moderate to severe goes through radiology.
So you think you're getting what you are doing is giving healthcare a lot more than pre-AI days?
Absolutely, sir. And I think the important point that I want to distinguish is that we bunch X-ray, CT, MRI as radiology because in eminent organizations like what you have led, you call it the radiology division. But we think of it much more as medical imaging in oncology,
sure.
medical imaging in cardiology,
Sure.
medical imaging in neurology.
Sure.
And so the opportunity to build in multiple care areas through a single modality like an X-ray or
Okay.
CT and an MRI
Okay.
is very exciting.
Great, thank you. I have a few bullet points like this for all of you, but maybe what I can do is, especially for our esteemed panelists who have joined online, kindly join. So I will sort of like to ask you, give you a couple of minutes on your perspectives on AI in whichever way you want to. Giri, off to you, with your deep experience in located in Silicon Valley, what would you like to say in a couple of minutes on whatever you want to cover?
Thank you, Anjan. I would like to actually first thank Dr. Ajit, Dr. Ajay, and Dr. Shirupa for making me part of this exciting event. And as Anjan, you already know, healthcare is very, very close to my heart. I mean, one of the reasons I founded Experience Flow is, like you were alluding to, is essentially because of my experience of my mom going through hospitals in US and in India. And I think like this space, I mean, like, I'm not looking at it just from the perspective of patient care. I'm also looking at it from the likes of Rajiv here. Like essentially, healthcare is not just patient care. That's the realization that I came to, right? Essentially, it is also the care professional that is part of it. They are getting burnt out with the hours that they actually, spend in front of the critical care. And also professionals and head of operations in these enterprise scenarios, their livelihood depends upon making the business actually run and thrive, right? And the key realization that I came to when I actually looked at this, not only from my mom's perspective, but also from the perspective of the care professional and the CEOs and the head of operations, is the only way you could actually solve this problem is to augment every human in the enterprise with superpowers. And the superpowers are basically going to come from AI, right? As a big realization, I mean, the realization that I had was the paradigm that will succeed in the long run is the same paradigm that's going to succeed in the car industry, which is essentially bringing autonomous driving into the car industry. And the same paradigm has to come into hospitals as well. And this is what led us to create this exciting product that we call as Enterprise Digital Nervous System. And to me, I always want to look at hospital as a holistic arena where you have to kind of have solutions end to end. And I think like I really like what Kalyan just said. To me, the lowest hanging fruit is definitely radiology. The diagnosis start, and if we can actually tackle that, if we can actually make it a norm in most hospitals to be diagnosed more accurately, efficiently,
Excellent.
and also unburden the radiologist from the mundane, I think it's a great start.
Excellent.
Right?
Yeah.
But we have to take it further from that. I mean, for the likes of essentially Rajiv, essentially you would have to now translate that diagnosis into some optimal planning, right? Like, because like essentially what kind of diagnosis will come today is completely stochastic. What kind of machines are available today is completely stochastic. What kind of professionals are available today is completely stochastic, right? And that's what we are tackling as part of Experience Flow. And we call this a big planning problem. And this is where I think one of the points that Anjan was making, which was essentially, obviously, currently there is a lot of hype cycle going on with ChatGPT and LLMs and generative AI. But we believe essentially the technology has to go to the next level beyond that.
Sure.
And that's because, like, the key point is the product here is essentially a human being.
Yeah,
and the human being, you have to take into consideration several factors. And the most important thing is, like, you cannot have false negatives.
Sure.
Right? False
Yeah.
negatives, false positives, and things like
Absolutely.
that. right? I'll pause here. As you can tell, I'm very passionate about this. I can go on and on about
No,
this.
we'll rotate around and you will have a lot of things to share with the audience. Are you finding this interesting so far? Yes. Great. So Rajiv, I'll go to you next for your couple of minutes of perspective. And actually, I think Giri has laid on to you sort of, on the one hand is the super technologist, thinking of future technology, building it. On the other hand, the super deliverer who is already thinking cutting edge and modern. Your perspective for a couple of minutes, please.
Thank you, Anjanta. And you have always been very kind and gracious in introducing me, and I'm really thankful to you. And really consider very fortunate to be part of this elite panelist and also in front of the students. And there has to be something very pressing that somebody has to miss Goa. So my apologies, I missed the opportunity because anyone would love to catch on a flight to come to Goa. So students, my sincere apologies. Next time I would love to catch up in person and share time with you guys.
Sure.
Having said that, I just want to pick up from where Anjanda left. He made a very interesting point, and that was about patient centricity and patient first. And that is what is the core of Marengo Asia hospitals. And I'll just take 1 minute on this.
Sure.
As a clinician, I have worked on both sides of the table, as a doctor, as a consultant, as a manager. Now today, after founding this Marengo Asia hospitals, when I'm leading this organization, the discussion is only one point. Whenever a doctor comes to me and says that this is the molecule, this is the consumable which should be introduced in the organization, my first question to that person is, will you prescribe the same to your family? That is the most important. If you can prescribe and your hands will not tremble and you will not think twice before prescribing that medicine or writing that test to your family member, please consider it as done in Marengo Asia Hospital. And this is my request and appeal to all the people, youngsters who are getting into the healthcare organization.
Sure.
Please ensure that whatever you do, the patient centricity is of utmost importance. That is the first starting point of life. Moving from that, coming to the topic of the day, I think whenever we graduate as medical students, we all get similar degrees. The skill sets are different. And I think the AI is something which can aid in trying to fill that gap. Not all the CTVS surgeons are same, not all the laparoscopic surgeons have same skill set. The clinical outcomes differ. Why do the clinical outcomes differ? There may be reasons. That is where I find as a surgeon, there could be a precision in surgery decision making which can help us. And AI is the right answer which can help us in bridging the gap. Giri mentioned a very interesting point about diagnostic. The entire journey of the patient starts from diagnosis. If you have been able to diagnose it correctly, whether radiology or pathology, you will be able to chart out, you will be able to take the patient on the right path of the treatment.
Sure.
So I think this is the lowest hanging fruit. Sure. And we at our organization today, all our radiology x-rays are done through AI. We are aggressively performing that. In addition to that, what we have done is we have introduced AI through our intelligent radiation therapy system so that the radiation dose of the patients can be reduced by 18%. So one, you are trying to create a course of the treatment, at same time see what will benefit the patient also. So it's a combination of all these activities put together. So I think I will also wait for other panelists to speak and not take more time. While the focus is whether AI can help us in trying to make correct decisions, whether AI can help us in trying to better the clinical outcomes. Can AI help us in trying to create more safe environment for the patients and build trust? Within 3 to 5 years, if we are able to gel the human skill set with the AI, I think the clinical outcomes of the patients will improve over a period of time, and we are heading for a better times from the clinical outcome and for the patients. Thank you, Anjana. Over to you.
Thank you, Rajiv. Again, such wisdom pearls actually bring out new good thinking. I would like to highlight this for the future leaders, that healthcare is about teamwork. It's not a solo game, it's not a solo singles tennis. You can't lead healthcare in any capacity unless you are a team person. That's the next thing that from experience it comes out. It is a soccer game. it is hockey, it is cricket, whatever. So very important is the collaboration. You can see two stalwarts sitting there, and I'm thinking of what kind of collaboration opportunities, I mean, tremendous opportunities remain in this kind of high-tech AI future. And on the other side, you have to have someone like Dr. Rajiv Singhal, who is willing to experiment, who is willing to experiment within his domains of asking his doctor, would you do this for your family? And that's it. That's the, you talk about code of ethics and all that. Code of ethics is in your soul. And that is an important thing for future leader. You will also succeed as leaders if you don't compromise. You just follow your soul and you will get the right answers. Thank you, Rajiv. I'll go to, Bain has had many friends over the years, Dhruv, and I've had the pleasure of learning from them. So it's a pleasure to have you on my panel in gym for the first time. And I have huge respect for Bain, for what Bain stands for. Bain stands for this, the content part. So your 2 minutes, please, and be free-flowing on AI, future of healthcare.
Sure. Thank you so much, Anjanda, and thank you so much for having me, Jim and Dr. Ajit and others. So I think it's a very interesting discussion, and at Bain, we get exposure to basically how a lot of different companies are thinking about AI. So, I mean, I don't have a crystal ball in terms of, how AI will evolve, but, 2.5 years ago, we partnered with a small company, and that company came out to be OpenAI. So, over the last 2 years, we've actually partnered with OpenAI on multiple, different instances of, how AI is getting used. And I think the one reflection is, I've been in healthcare now for over 2 decades. And I think healthcare as a business has been a laggard in terms of adopting technology, I think historically. But what we are seeing in AI is very different. Healthcare is at the forefront, like in line with where a BFSI would be, where others. So it's very interesting how AI is evolving. And healthcare is actually, I'm seeing it at the forefront of, adoption of the technology, which is very interesting. And a part of it, I think, comes from where Giri was talking about. One is the patient, but there is also the doctor and the nurse. And, they are a very important part of the equation, and they are in a massive talent shortage. Not only in India, but even globally, as you talk to folks, that is always a concern in terms of having the right docs and nurses. So how can the technology enable doctors and nurses to deliver better outcomes for their patient is a very important lens. And hence you start seeing adoption of AI in multiple different spheres. So, and I think as Kalyan was saying, radiology was the first to adopt because it is enabled by digital. But now you're seeing this starting to come out in applications in multiple different areas as well. So yeah, and we'll talk more about the different use cases and all, but looking forward to the discussion.
I feel like asking you a quick side question, Dhruv. So Bain, for your own super consulting, if I may say, business opportunity, because here are leaders who could go anywhere. In future they could go to a diagnostic lab. I think in the afternoon we have Amir Shah, like Rajiv, we chose you and Amira for obvious reasons. You are future, frankly speaking. So, and doing so well. So, do you foresee a lot of AI opportunity in consulting?
No, completely. I think it is changed. The amount of work we are doing in AI globally right now is very interesting. And if I would just put it in terms of how adoption is happening, if you look at, AI till 2 years ago was, people were kind of figuring out. I would say there was a lot of pilots which happened, right? So if you think about last year, was a time when people were getting familiar with AI. So many of the companies were, talking about how do I pilot, what do I do, how do I understand this technology better. Sure. This year, you now start seeing people starting to take big bets, and I think people are now getting more bold as they're getting more comfortable, and we are seeing that evolve. And again, if I reflect on our own business, till last year you would see a lot of work happening in the US, for example. This year you see a lot of the Indian companies also starting to experiment with a lot of use cases. So as you look at your futures and jobs you will do, this will be something you will encounter across different markets. And just in terms of another perspective here is, if you think about which use cases of AI are getting more prevalent, for example, in the delivery system, and it would be good to get others' views as well. So there are basically patient-facing use cases. There are internal use cases and then there are clinical use cases. I think you're seeing a lot of adoption on the internal and patient, and clinical starting to pick up with radiology, for example, as an area. But there is enough and more opportunity where some of the more operational and patient-facing use cases are seeing early adoption, right? And you will come across this on the operation side, on customer service. These are all use cases where you're seeing already, as Anjanda was saying, AI has been around us for some time. We hear the buzz more, but there is intrinsic elements which are kind of coming in on this side.
So that's good news for you all. I mean, you have. I'm so happy and proud to hear that the one of the focus areas for leading consulting organization like Bain, global leader, is India. And very interesting. Even I would ask Giri to comment on this later, because I mean, he is from India, located in US for a quarter century perhaps, and all over the world perhaps, So Giri, just keep this reserved for the concluding comment. I'm very interested in knowing this, your perspective on what Dhruv said just now, that in healthcare technology adoption, healthcare has been a laggard. But in AI, healthcare seems to be leading. And I'm looking at your esteemed director now, because BFSI is there. I'm always, looking at, I'm a little parochial about healthcare since I am basically for HCM, but looking at the others, and it's an interesting discussion point, why it is the other way around suddenly. I feel when adoption happens, when there is a spur of demand and you have no choice. Like they say, necessity is the mother of invention. So I think the stakeholders may have felt that in healthcare you have no choice but to go for this for reasons both Mr. Giri and Dr. Rajiv mentioned, efficiency and safety, quality, a combo of things, optimal. So I'll now go to Nakul. Vadhwani is very esteemed organization. We all have, and Nakul is the Director Solutions for Vadhwani Institute for Artificial Imaging Focus. Nakul, your 2 minutes, whatever you want to share with us.
Yeah, thank you everyone. Firstly, thank you everyone who's got me here. It's a wonderful opportunity. I totally agree with Anjanda when you say that we are living in an era where we are seeing things out of sci-fi movies in reality, right? We are seeing AI actually being enabled on field, making access better, making more equitable environment for everyone, making things more available for everyone, better outcomes for everyone, right? We also know that AI is being now used across different domains of healthcare. We are using it for decision making, we are making for support systems, we are using it for capacity building, training, multiple domains, and we'll talk about some of them. I also want to bring in a perspective where what has led to this sudden burst of AI, and this is something that at Vadhwani, I think we started working on around 6 years back, where we realized that the last few years or maybe decades were era of AI in lab, and this is the era of AI on ground.
Very good said.
Right.
Very good.
So how do we do that? What we realized that technology perhaps is the most simple part of AI implementation or enablement, right? It's everything that surrounds technology that actually makes the most difference. Do you have the infrastructure? I mean, there's no point building AI if there's no infrastructure to support it. Or can you tailor AI to work in the infrastructure that already exists? Even if I put in AI in place, have I done enough capacity building for people to adopt it? Have I taken care of the social behavior that as an organization all of us will have to drive in order for people to adopt AI? Are the protocol, policies, processes in place for anyone to leverage AI, right? There are data sharing policies, there are regulatory frameworks, there are ethical frameworks, right? There are a lot of things which currently or over the last few years have lacked certain clarity, because of which, while there was intent, AI did not see the light of the day. A lot of this given now is changing. There is an opportunity for the actual technology now to come to the forefront and be deployed on field.
Sure. Excellent. Thanks for bringing that perspective out. AI is so far in the lab, now AI is on ground. So you are actually, many of you are second year in a few months you will join the industry and you will straight away land into this sci-fi environment which is now on ground. And you know what is leadership? Why are you doing in an eminent institute like Goa Institute of Management, healthcare management study? Leadership is about knowing at first and knowing your challenges. And this is going to be, challenges not in a negative way. You need to be prepared for how you adapt yourself in leading your team, whether you're in manufacturing, in or innovation, marketing in Philips, or manufacturing in another organization. You will face this challenge. And therefore, it's important to know that already AI now from lab into the ground, you guys and young gentlemen and ladies have to drive this, drive it. It'll be good for your career, good for contributing to the industry. Is it making sense so far? Yes, sir. ये कोई सुना ही नहीं दिया मेरा. Okay, great, good. Now I'll go. I think we are managing the time so far very well. Thank you everyone for that. I'll go into quick bites on 10 to 12. Sounds high number, but still we'll try to manage. If I have to cut off some of the points, I'll do so. There's a big clock that our director has put there. I missed it so far. I was looking surreptitiously at my watch. So there are some big now from the umbrella view, we are coming to specific some thoughts that I've shared with the panelists, all of you. And per point, I will direct I won't say question, your thoughts I'll invite on each of these. Medical imaging, already Kalyan and Giri touched upon. Predictive analytics. You all know, being in healthcare, what is predictive analytics? Prediction is the key to healing. They say in abhi chota sa, kuch hurt hua, our grandmas would say, put the ice immediately. बाद में दूंगा, बाद में देके फायदा नहीं है कुछ. Sorry if anyone doesn't understand my Hindi. There is no point. You save a man or a woman patient by being quick, for example, when there is a cardiac arrest, So predictive analytics can save patients from cancer patients from reaching stage 4 or stage 3 by starting proper treatment, say in whatever cancer of the organs that is there. So predictive analytics is very important. And I'm going to ask this to both Giri and Rajiv. Actually, all of you are viewing YouTube in a split screen, and for me it's great. Here is the technologist, here is the healthcare deliverer, and the two of you, according to me, constitute the best collaborative teamwork that is needed today as we talk about healthcare for future. So for me, it's a very optically it is looking good. So predictive analytics, for example, AI predicts patient outcomes, identifies high-risk patients like I just mentioned, and detects early warnings for diseases like sepsis. Giri, off to you. Rajiv, off to you. You decide, the technologist goes first or deliverer goes first. But we'd like to hear your thoughts quickly on these points. This kind of predictive, using AI. Is it going to give better predictive analytics in future using AI?
Sure.
Yeah?
I'll kick it off and I'll pass it to Rajiv because essentially he has to obviously deliver it. So
that's right. Yeah.
So I like that from Silicon Valley to Gurgaon Valley. I understand.
Rajiv, I'll bring Giri to you next time that he is in NCR, and it will be a good discussion. Yeah, please, Giri, go ahead.
Yeah. So I think Dhruv was alluding to this. The application of AI in healthcare is taken off at the patient level and also at the internal level, but it is still lagging in the outcome and the clinical path. And there are several reasons for this, obviously. But at the same time, whatever is feasible is of immense value, right? Because this is the heart of patient care. If you can actually accurately predict the sepsis-like scenario, there is nothing like it. I mean, I can tell you from my personal experience, right? And to me, the technology exists, but what is lacking right now is obviously the data. There is a lot of sparsity of data, right? Because the clinical diagnosis, are very complex, and there is combinatorial in the space in which it exists. So to me, the technology exists, but operationalizing that technology is the difficult part. And this is where I would actually essentially look at leaders like Rajiv and others to kind of think about how to share that data across at least their own hospitals, right? Because this is something that we saw in the US as well. Getting the data out of the healthcare systems was very, very difficult. But obviously, like pandemic kind of drove some of those behaviors, which kind of led to, opening, like for example, Epic was a very closed system. It started opening up data, right? Sure. And this is where like the hospitals actually had to play a key role in demanding from the vendors that that data doesn't belong to the vendor, but actually belongs to the patient. Sure. And it is in the interest of patient health that we need to drive that openness and sharing. Sure. And that's what will lead to the next level of essentially decision making.
Sure.
I'll add one more point.
Sure.
And the other point is the technology that is needed to actually drive improvements out of this prediction is going to be very, very different from what people are seeing right now. I mean, obviously, it was interesting for me to kind of actually, I knew that Bain was participating in OpenAI. So right now, there is one set of technology that exists, which is basically based on Gen AI and LLMs. But what we will see from at least like from the heart of the technology world is it will go specifically for healthcare. It has to go into a lot more robust models where thousands of factors can accurately lead to the diagnosis. And this is where experience flow comes in. I mean, we have basically built a gigantic graph in real time. That's what we built. And we basically kind of connect like not only the outcome part of it from the patient side, but also to the various decisions and actions that have to go into that planning. But obviously, like essentially we will look to bold leaders on the hospital side who can actually change that workflow that needs to follow through when it comes to like, taking that outcome to operations and things like that.
Sure.
Over to you, Rajiv.
Giri, I think you have hit the nail on head by saying that exactly the one of the biggest lacuna today is collection of the data in the format which can actually help us in trying to reach some logical conclusions, whether in predictive part of it or even diagnostic or even the disease management. So I think that is one thing. As if we want to hold ourselves accountable as leaders in healthcare, I think the time has come where we have to basically start putting the infrastructure in place, invest into that kind of basics which are essential for us to get to that stage. Because if we are unable to give data to the scientists like you or rest of the people who are sitting and the aspiring scientists, they will not be able to help us in trying to run the operation. So I think let us face the truth and reality. Yes, this is the need of the hour, we should do that. That's part one. Having said that, a couple of things have come out very interesting, like in Inauguration hospitals, we are putting now from a predictive stuff, we are actually, for some complicated patients, we are putting biosensors, especially when they move out of the ICUs. Around 1,000 have been put. I would say from a command center perspective, we are able to save 3 to 4 lives per week because of, so we avoid the code blues, which is like amazing. So you are actually preserving the cardiac function by just putting technology and also converting and then utilizing the technology on that piece. Amazing. That is the kind of work, and we look towards more people who are into the AI space, who are willing to utilize a platform, who can help us in trying to make patient care much better, to come to Inauguration, just work with us. We are there to give that platform. That's a very open this thing for anyone for that matter. I spend at least 2 days in my week connecting with all the people who are working in AI space, because I am also in the learning phase. I am like a student. People who are sitting on this side, I am student of AI today. Sure. I continue to learn and say, if I don't learn, I will not be able to take this to this thing. So I meet multiple people at least twice in a week to understand what is best, what is happening, where are we lacking. Sure. So I think potential is huge. Potential is huge. As our colleague from Bain said, it's good to see that in rest of the places, the healthcare was not fast, quick enough to adopt. But I think in AI, I think we have been intelligent enough to adopt AI. I think that is something better. And I look for more association, more partnerships, more exchange of knowledge with one single agenda. If it can help the patients, nurses, doctors, I think we are there as a leader in the world.
Excellent. Thank you.
Over to you.
Thank you. Yeah, I will still continue with you, Rajiv, a little bit. Allied question. You know, one is this part, the other is personalized medicine. This is all, like you said, you know, you stole a sentence, if I may say, I love to use, like I am a student. I am still a student. I only wish that I was a student with their age. And with so much to learn, you know. So it's an eternal learning, you know. So personalized medicine, you know, I was reading and I'll read out. AI is not only predictive, helps tailor-made treatment plans. You would be knowing about that. What is the outcome of what you are doing with the images? Finally, it has to be a treatment plan, you know. Healing has to come out of that. So treatment plans to individual patients based on genetic profiles, medical histories, lifestyle, which sort of, in a, if I may use the word crude way, pre-AI also it was being done. So do you have a perspective on that? I will ask this to you and to Kalyan, because what you do is great. What happens after that? Your thoughts on personalized medicine. So Rajiv?
So I think this is so relevant, and I'll give a simple example because I'll give a very clinical example. Today, if there is a patient with thyroid abnormality, we have a very standard age-old regime which is being followed all across the world, where people will say, take this particular tablet, either one tablet, half tablet, 1.5 tablet, this thing, without considering the lifestyle of a lifestyle and the work profile of a person, because hormones, they have a fluctuations which happen because of the lifestyle and the kind of work people are doing. If I'm able to do it in a personalized manner, then the dose efficacy is much better, the medical outcomes can be improved, and this is all hormonal play at the end of the day. So we would like to titrate and say, find whether this can actually follow a pattern of the work pattern, the lifestyle pattern, and then what will be effective, and whether it has to be कि सुबह खाली पेट खाना है या उसके स्ट्रेस के टाइम पे खाना है, so that the medicine can become far more effective, and it is actually tackling the surge in the hormone levels. That is the most important part. Somebody has to look at it, why the heart attacks happen at 4 o'clock in the morning majority of time. What are the hormonal play which takes place? What is the dawn phenomena which takes place at 4 a.m. in the night? That is where I think the AI has to help in trying to do this, and we are looking at certain such parameters, working with people on personalized stuff.
Excellent. And Kalyan, your views on this?
Yes, sir. There's a spectrum between mass medicine and then personalized medicine of n equal to 1. In diagnostics, I think that with multimodal data, we're getting from mass diagnostics to personalized diagnostics, and I'll give you an example. Let's say there's a patient who has fallen down from a bike and they get a CT scan, and the patient has calcified foci, which white dots in the brain. Now, the calcified foci is the finding, but what is the diagnosis? And the correct answer to that is it depends. If the patient has fallen in Karnataka, you can probably say that those dots are actually contusions. But if the patient has fallen in eastern UP, then it is actually neurocystic
Really?
Right? Because there is pork eating, like in eastern UP, the amount of pork that is being eaten, uncooked pork is very high, and tapeworms can go all the way to your brain.
What an example.
So depending on this, on the demographics, the disease has to change. And I'll give an example of how that is actually implemented, and one of my proudest examples. If I see this and I have demographic information, I can take a call depending on where the patient is coming from, and I won't have all the data. But if a patient is from eastern UP and I get a scan from there, I can say that if there is calcified foci, you need to do a contrast CT, and you should start this patient on an anti-helminth because it is probably neurocystic.
Fantastic example.
And so that is a good example of how AI can actually come into the care cycle, sir. So it's not all the way personalized, n is to 1, but it is not mass either.
It's a terrific example.
AI is actually going towards, based on where you are, based on your situation, you can actually take a decision which is much more informed than if you didn't have the technology.
You know, healthcare is now becoming like an orchestra. There is really no scope of solo players. So Giri, I think you will have a sleepless night absorbing this, because your job seems to be expanded more and more. And by the way, Experience Flow, Mr. Giri's company, has there is alumni from gym located in Goa. Goan Trevor is located in Goa, right, Giri? I think
Yes,
in
yes,
marketing.
yes.
So,
we're
so
very proud.
you
We
have
are
precedence
members.
of a highly satisfied gym alumni and highly satisfied staff of Mr. Giri's Experience Flow, which is headquartered in San Francisco in the Silicon Valley. So it's getting all connected. The dots and T's. Excellent example. Even I have goose pimple. मैं पहले सोच रहा था क्या बोल रहा है ईस्टर्न यूपी एंड कर्नाटका हाउ डिफरेंट बट दैट्स इट द फूड हैबिट्स एक्सेट्रा नेक्स्ट these are all bullet bites guys are you getting breathless or you are following the discussion are you enjoying it just one moment these are all fraud calls I think Giri you have to do something in India the fraud calls are becoming too much and all kind okay. So next is a mundane sounding. You guys are following what's happening? Is it? Tell me frankly. Is it? Are you feeling challenged in a negative way, or it's exciting for you? Pakka. Yes. Good. Then I think Professor Ajay will ensure that there are extra classes now on AI management in the evenings, Sundays. Okay. Now next one is on a mundane topic, mundane sounding. You must be guessing, as leader, you have to deliver even targets. Therefore, efficiency is the key word. Whether clinical efficiency, you heard from the experts. I'm asking a mundane sounding word. Chatbots and virtual assistants. I'll give you a small snippet. When Giri started using the word bot with me for the first time, I used to live more in Goa, director at that time. And I had to actually ask him after some time, what is bot? Yes, and this guy is moderating this panel on AI today. Giri would remember that, but Giri is so polite, he didn't say anything further. He said, oh, robot, so chatbot. So chatbots and virtual assistants. So the question here is AI-powered chatbots provide patients with personalized support, answer queries, schedule appointments and all that. So here, again, Giri, I go back to you because it's efficiency based on technology. I'll go to Giri and Nakul for giving two perspectives on this. That whole thing about chatbot, virtual assistants, students would love to know also. Any thought on this? I mean, for laymen like us?
No, absolutely. Actually, one of the most interesting things about this chatbot phenomena that I kind of, love about is, and I think like anybody who has dealt with any kind of enterprise system, whether it is like, Salesforce, ServiceNow, and especially like, in healthcare, sorry to say, any of the hospital systems,
sure.
The user experience is so complicated,
sure.
right? The user experience is so complicated, and for most patients whose focus is on their health, it's so difficult to navigate these tools.
Sure.
And to me, one of the things that we have been passionate about, and I shared this with Anjan, and that's the context of bot. And we knew from day one, right? The leveler of essentially the user experience is going to be AI, because the interface at that point is going to become like the human language, right? And this has been our theory for a long time. We have integrated it deeply into our solutions. But to me, this is beautiful. I mean, this is what will now enable essentially the truly personal care where the patient can actually share exactly what they're going through.
Sure.
Because the health is essentially a very personal and private thing. And many of the people probably don't want to actually share. But as these technologies are getting better and better, as they get better at language, dialect, personality, sentiments, etc., and all that stuff, there is so much to achieve. And we can get rid of all that legacy user interfaces that existed, which make life complicated, make a lot of mistakes, etc., and all that stuff. So I'm super excited about this future where essentially these multimodal agents are available and are providing this patient care.
Excellent.
Over to you.
Thank you. Some of you are looking a bit concerned. I would have been a bit concerned also. Maybe you have to lead humans as well as bots in the coming days of your life. And I'm sure that's going to happen. I was reading it. There are so many articles every day in Times of India. There are some new articles on AI. So I'm going to Dhruv and Nakul now on. I think your perspective is important.
Yeah, let me just give another perspective. Let me touch upon the other important pillar of healthcare or public health in general, which is the field healthcare workers, right? How chatbots are relevant for them. We live in an era of information overload, right? There's so much information everywhere, so many different websites, WhatsApp, everyone has, different sort of information. Now imagine being an ASHA worker or an Anganwadi worker or an A&M worker, you're on field, you're managing 10 different programs within health ecosystem. You're managing a NCD, you're managing a TB program, you're managing polio, you're managing vaccination. So many different programs you're managing. Sure. Every program has given you their own application. Every program has given you their own guidelines. There's so much nuances, which is very difficult for a field worker to, have all in mind and answer accordingly. Now, chatbots play a very important role here. If I'm able to give you a tool, which is an application in a mobile phone, I can speak to that application, I can ask relevant questions, I can ask contextual questions, and the chatbot can give me answers and also point me from the guidelines or from the ecosystem where they are expected to work in, from where did they produce that answer. My life becomes super easy.
Sure.
I'm able to take decisions faster. So
yeah, exactly. And finally, it all translates into efficiency for the system, accuracy and quality, safety for patient care, right? I mean, that's what we are looking for the patient. Oh, sure. Please, Kalyan.
When it comes to chatbots, I think there is a clear application where there is a huge amount of truth that is known that needs to be distilled and understood at any time.
Excellent.
And I'll give you an example. Yeah. In most hospitals, Dr. Raji will also agree, radio technicians are always, going in, coming out. They're basically wanted radio technologists is painted on the door because they always required.
Sure.
So when a new person comes in and is not as well trained, they may not know how to do a complex protocol.
Absolutely.
So for example, we have built a bot called Protocall, CALL, where somebody can write what is the MRI demyelination protocol, or what is the protocol for a liver abscess. And you will get the hepatic hemangioma protocol, and it will tell you exactly what sequences to take in an MRI.
Wow.
And incidentally, I think the exciting thing for everybody here is that bot took us 3 days to build. Because today, all you need is a open source LLM that you can host and run something called an RAG on top of that. And actually, Prof, it will be an exciting project for a bunch of people here to actually build out their own bots using retrieval augmented generation, which will give everybody a really deep understanding into how these LLMs work.
And it took 3 days, that's it?
3 days.
Excellent.
Yeah.
Good, guys.
Yeah.
Okay. I think, I mean,
It'll not take more than 5 for the team here.
This is sci-fi happening in front of you, I mean, you are not in the past or present, you are in future. So I quickly go to, now tell me, I don't know where is Professor Ajay Sidupa I can see. So do you find this discussion meaningful and exciting?
Yes, of course.
Can I have 5 minutes extra for this beautiful discussion? Because after this is lunch. This is give and take barter systems. Guys, would you like to compromise with your lunch for 5 minutes, 7 minutes for our extra few minutes? Okay, let's do that in a few minutes, a few bullets now. Now, Dhruv, disease detection and prevention. We touched upon this a little bit. Predictive analytics is connected with that, but specifically I wrote down what sort of I read. And the exact lines is AI identifies patterns and anomalies to detect diseases earlier. We discussed that. Enabling preventive measures. So this is for you and Nakul. And Nakul, because lot of what one is work are with, if I may say PPP, crude word, but public sector related, etc. Your thoughts, please.
Yeah, so I'll give a quick example here, but I think the fundamentals of early detection are also basically a lot of it starts from radiology. So there's a very interesting program called lung cancer screening. Lung cancer, as you know, is a deadly disease. If you have it, basically you're gone. Yeah. So I think in the example here is a little bit from the US. And if you look at the US health systems, lung cancer screening, today there are massive budgets out there from the government. But the number of people who are eligible to do lung cancer screening versus the actual people who show up is 5% or 4%. And this is after continuous push from the government over many years. And one of the issues is, one is you do the lung cancer screening program, but once you're there, there's a lot of follow-up that needs to happen. So AI plays a role, first of all, in detecting from that lung cancer screen, basically, is there a nodule or not? But then also following up with patients to come back for the next steps. Think about it, there's a massive volume of patients out there who could potentially, go through the lung cancer screen and then come back for the next round of treatment. The lung cancer screen detection and then the follow-up in terms of patient management is a highly manual process today. And if you use AI properly, you'll be able to do that much better.
Sure.
So this is an example how the US health systems, for example, are using AI, and there are companies specifically being brought in to do some of this, not only detection, but also the patient management and flows after to make sure this happens appropriately.
Excellent. Great example. So, Nakul?
Yeah, I'll give another example in tuberculosis, which is one of the major burden for the country, right? Now, the symptoms might not show for all patients. We have proven statistics that, we miss around 13% of the patients in the country which have who have TB and who have the potential to spread TB, right? The current protocol, the National TB Elimination Protocol, is a very symptomatic approach where they will only take patients for further diagnostics if they show some specific symptoms, right? What we've been able to develop as an AI solution is a cough application where along with symptoms, we also take cough sounds. And it's been proven that, cough sounds have signals of tuberculosis, which means that we might be able to detect a TB case or screen a TB patient way ahead in time. We have also proven with our pilots in multiple geographies that, there were patients who showed absolutely zero symptoms, were positive on the application, went on to do testing and came out TB positive, right? So there's a huge potential to, for applications like cough or others,
sure,
to identify those 13% of the cases that are currently being missed in the country.
That's another great example for our young students here. TB, Nakul, is now in the domain of Prime Minister's personal attention, right? You would like to, just so that you can correlate how important is this statement that Nakul made. Cover 30 seconds on this.
Yeah, the idea, TB is an infectious disease. Until we got COVID, TB had the most number of deaths across the globe, and India is a high burden country. So the Prime Minister has this vision of eliminating TB by at least 2025. The global vision is 2030. So there's a lot of effort that is being made to eliminate TB.
Yeah.
And an early detection is one of the prime need of the hour, given the infection rate or R value is fairly high for tuberculosis.
You know why I requested Nakul to bring this point out? As young leaders of future, you all, I would in your shoes always feel ecstatic if what I'm doing, I know in organizations like what is being done for TB eradication program. If I know that as leader after gym management course, you are contributing to something like this. Isn't that delightful? Yes. That's fulfilling, right? So that's important. It's not only the salary package, which is important, of course, but there are other factors in life. I can tell you from experience. Giri mentioned about passion and all these things. So now all good things need to come to an end, and this summarizing is impossible. This is my note. I will summarize it for Professor Ajay to disseminate amongst the students. I think I'd be delighted to come back to you all as I've done in the past and chat more on impact of this futuristic technology called AI on healthcare leadership, something like that. So there are pearls of wisdom. I'm sure you have absorbed as much as we have. And there is, some things are open-ended. There is no point in summarizing. The summary will be possibly in your class or in your courses for future. I would request now our esteemed panelists, to give like the TV anchors say, bullet points, bites, etc. I'll give 3 guiding small things that I have picked up, which could be big challenges for future on AI in healthcare. Can you hear me? Yes. Am I audible? And you got a mention of it without my telling. You heard about infrastructure, you heard about skill set, and you heard about mindset. So I'm very happy that my thoughts were in the right direction amongst these eminent panelists. I would request all of you to give a 1 minute, 30-45 seconds, 1 minute bite on your thoughts on these issues, how important, or anything else that you want to say. This is the conclusion of this wonderful panel. So infrastructure requirements, whatever we may want to do, infrastructure around us, government, what it provides is important. Mindset change of the leaders, not everybody is Rajiv Singhal. There are many leaders I know of who are struggling to adapt Rajiv, and possibly that's why Marengo is growing nicely. So infrastructure, mindset, and reskilling for all of you, skill set. So please go ahead. I think Rajiv and Giri will start with you. This 1 minute bullet. Giri, you want to go ahead? I think you are very polite with each other because you can't see each other. So let me start with Giri. Giri, please.
No, well put, Anjan. And I think, as you know, our journey basically will continue for a long time, experience flows journey. And because like everything that we talked about so far, I mean, can be handled in the tier 1 cities primarily, like in the best hospitals, best diagnostic centers.
Sure.
But what we felt is the need, and where probably AI will excel in the future, is actually tier 2, tier 3 city. That's where majority of the society lives in. And one of the key points that you mentioned about is skilling people. And I think like in those environments, in those tier 2, tier 3 city hospitals, I think skilling people will be extremely crucial.
Sure.
And I'm hoping some of the graduates that are coming in here are taking a long view of their mission on this earth. Earth is, I mean, essentially to me, for us to kind of, feel good about what we have accomplished on this earth, we have to leave some sort of a legacy that is humane and, essentially society driven. So I feel like that's, to me, is still on the horizon that we should push for.
Sure. Thank you, Giri. Rajiv?
So my take on this is, let's actually try to create a center of excellence in AI over a period of time. Let India become, and there are 3 essential components when you think about creating center of excellence.
Sure.
People, process, and infrastructure. If we can actually combine these 2 things, I think India over a period of time will be the powerhouse of AI. And I think this is a small beginning which is taking place from Groga. I think, as Giri said, maybe after 2 to 3, sometime later, we will say that this is the legacy which we have created by creating the center of excellence in AI. So I think, and we all have to continue to stay connected post this conference so that we have different platforms. We have knowledge bank which is there. We have people to work. If we all can join hands together and not leave our friendship and collaboration only up to this world, the way we want to change the world. Thank you once again for all the colleagues, Anjanta, and the students for patient listening. And I missed being in Goa, and my sincere apologies. Next time I'll be there.
No problem. But be around for a couple of more minutes. Can you be? Can you be there, Rajiv, for us to finish in a few minutes?
Yes. 100%. I'll be there.
Great bites, legacy, very important. Passion, leave something for future. Things that, in fact, I'm again looking at the director and the faculty here. Center of Excellence for AI, that's a nice challenge thrown by Dr. Rajiv Singhal, and in line with what all new fascinating things that Jim has done Jim is Goa Institute of Management, of course, has done in the last few years. Maybe we take up this challenge and explore, is there a possibility of Goa Institute of Management in healthcare or beyond healthcare, because you have data, BFSI, everything to take up. We are noting this. I'll love to discuss with you and other faculty members. So let me go to Dhruv. Dhruv, your bite.
Yes. So I think this is a very good provocation, Anjanda, on what needs to change. And in all the publications, whatever you need in the media, people talk about how the technology is evolving on AI. But actually, when we start working with companies to implement, the big part which you don't talk about is the change management.
Yes.
And what does it take for people to actually adopt AI is not a trivial question. All the, we have all the, all the science fiction, all the interesting stuff, but eventually it's the person on the ground who needs to adopt AI.
Sure.
And I think the question which we need to very consciously answer is, what's in it for me?
Sure.
Right. I was talking to a doctor recently, a radiologist, and he was talking to his next set of classes. He was coming back for a conference and all, going back to his alma mater. And, he was like, I'm telling people, don't take radiology, we will get replaced, right, by AI. So, it's like, so we have to solve for that. We have to solve for the fact that it's at that level. Radiology is one of the most prestigious areas where, doctors are, we're getting doctors graduate and most coveted, but people are actually saying, go to another space, radiology is getting disrupted.
Sure.
And that's what we need to kind of solve for.
Yes.
And I think the realization so far, at least for me, is AI will always be an enabler, not a replacer.
Sure.
Technology is very far away from replacing what a human can do. And
Sure.
hence the change management aspect is an important part as you adopt AI in organizations you work for, as important as the technology itself, or
Sure.
even more, I would say.
Sure. Thank
That
you.
would be my
Very good point. I personally think change management for the future managers, leaders, and Kalyan, your?
My bite would be that in today's world, you can do much more with technology than you ever could. For example, in healthcare, my strong opinion is that there is no such thing as unstructured data today. With multimodal models that can actually read anything, especially photos and images, there is nothing called unstructured data.
Sure.
So if anybody is working in an ICU setup, you don't need to integrate with the monitor anymore and figure out that. You can take a photo of the monitor or take
Sure.
a video of the monitor,
There you
and you never have to actually integrate with the monitor data
Amazing.
pipeline.
Amazing.
I think that the technology exists,
Sure.
and even the clinical will exists. But I think there is actually, at the moment, a lack of imagination by the technologists to actually solve problems.
That's the mindset part.
You spoke about predictive analytics. I think the biggest problem is technology people will go to a hospital and say, I will do predictive analytics. Predictive analytics of what? If you have clinical domain knowledge and say, I will do predictive analytics of community acquired pneumonia in your ICUs and tell you who to step up or who to step down, that is a very focused problem.
Sure.
And if you understand that clinical flow, and you understand the technology, then the world is your oyster.
Sure. Excellent. World is your horizon, sky is the limit. So that's it. So Nakul, last but not least.
Yes, so AI is exciting. AI is an enabler. AI is a powerful tool.
Sure.
To quote Mr. Spider-Man, with great power comes great responsibility.
Yeah, absolutely.
As leaders of tomorrow, as healthcare leaders of tomorrow, please use AI wisely. Okay. AI should not be your first resort. If I have to, I can build a watch using large language models, but do I need to? Always ask yourself this question. Make sure whenever using AI, you take into consideration the ethical, regulatory considerations. You're building it for people. There are people who will be using it. Like I think Dr. Rajiv mentioned, would you like to use it yourself? If answer is yes, then you should build it for people as well.
I think maybe Giri, I found you smiling because this is close to heart, what he said, this balancing thing. So all good things. I hope you found it good, guys. Please give a big hand for the panelists. I enjoyed it. I really enjoyed. I learned so much. So I will like to conclude by, I have this fascination for good quotes. Old IIT habits, you mug on the last hour and score good. So some quotes give that kind of thing. So I started with whom? I started with Confucius. Good, checking on you. So Confucius, he said, why make life things complicated kind? Now conclusion is we want to make life complicated, but as Nakul said in the end, not unnecessarily. This balanced approach is also a responsibility and accountability of leadership. And what Dhruv also brought out I like that, it's all about change management. It has always been. Now change management at a breathtaking pace. Run. So I'll now conclude and give it to Professor Sirupa, who is eagerly waiting for the concluding part with Einstein. So someone in a forum like this told Albert Einstein, you all know Albert Einstein, I'm sure who he is. So Albert Einstein was told that we never make mistakes. And his answer, as always, was very simple, that someone who never makes mistakes has never tried anything new. Kalyan, imagine at 30, if he has achieved this, what he will achieve in 50. Because he must have done a lot of mistakes, and his passion has ensured that hum 3 din mein ye karunga,
lots of mistakes, protocol
board. So I'm
What
sure
service
Giri
takes?
has, Giri is patience exemplified, believe me. I wish someday Giri comes here physically. I am envious of Giri's patience. When you are dealing with AI, you will have always a drive of impatience, but you have to be patient. And like Nakul said, that yeah, we can make mistakes. If we don't take risk, we don't grow, but be careful, be cautious. It's a balanced approach. Thank you very much. It has been wonderful for me, this 1 hour and 10 minutes. Thank you. Thank you. Thank you all of you. Shirupa, after you.
Thank you, sir.
Thanks all. Thank you.
Thank you to all the panelists for an insightful session. Now I would invite Ajay sir to felicitate the panelist. Professor Ajit sir can also join us. I would request everyone to be on the stage, so for a group photograph.
You can use AI to get us in.
Good thought.
We have to felicitate, Jim has to felicitate.
That can be added in a second.
Both of you. So you have to come here for that, I guess, next year.
We would request you to stay back. Professor Ajit will leave after lunch. So we'll take a final photograph with all our colleagues and all the speakers before. That's a final group photograph.
Rajiv will leave?
Yeah.
No, he can't leave.
Please. All our colleagues, please.
Please. See, this is adapting to changes group, to change management, right? Like change management. Please come.
We all now proceed for the lunch break. All the dignitaries are requested to proceed for lunch break.
Thank you so much for having us.
Students, please stay back. Students, stay back.
Ex-Roche, Novartis, revenue experts. He's on my board. So I'm coming with Shravan just so that he can connect with his brain. I want to say hi to, and then I want to take the next step to Malaysia. Then you're mine. He's the CEO of IHH.
Yes, I think that everyone. Can you just make an announcement?
Lovely to learning for all of us.
I request all the delegates to be back by 1:50 p.m. All the students can proceed for lunch as well and be back by 1:50 p.m. sharp. And after the lunch, there is registration as well, so you have to sign the registration sheet outside before entering the auditorium. Thank you.
check. It's a -10 असून सुद्धा बरं येतात.
Recording in progress. Recording stopped. Recording in progress.
Hello, hello. 1, 2, 3. Welcome back, everyone. So let's resume with the conclave now. Students are on their way, so I would like all the dignitaries to take their seats. So now I would like to have Shirupa ma'am for introducing us to the next panel.
Welcome back after lunch. I do see quite a few empty seats, but don't worry, our students are on the way. The rain just played a bit of a spoil sport, but by the time we delve into this discussion, I'm sure it'll be a full house. So without much delay, let me welcome you to another scintillating panel. This time we're going to focus on startups and how the startup is leading disruptive changes in the healthcare space. And that would be the point of discussion for the next 75 to 80 minutes. We have a stellar panel and we have 5 stellar speakers. Mrs. Amir Shah will join us virtually in around 2:45 or so, and you would get to hear her inputs then. We have 4 speakers already who have taken their seats, and before I invite my colleague Professor Arif to start with his role of the moderator, I'll take the time to acquaint you with their illustrious profiles. So please hear me out as I read out the illustrious profiles of the distinguished panelists. Our first panelist, who I said would join virtually, is Ms. Amir Shah. Mrs. Amir Shah is the Executive Chairperson and Whole-Time Director at Metropolis Healthcare Limited, which is a leading player in India's diagnostic industry. And in the past 2 decades, she has transformed Metropolis from a doctor-led practice into a prominent corporate entity, taking it public in 2019. Under her leadership, the company has consistently delivered industry-leading performance and secured investments from top private equity firms. Under Amira's leadership, she has earned her widespread recognition. She has been honored with the Ernst & Young Entrepreneur of the Year Award in Healthcare for 2021 and has been named one of Asia's power businesswomen by Forbes Asia. She has also been featured among the 50 most powerful women in business by Fortune India and Business Today. In addition to her role at Metropolis, Ms. Amir Shah is a prominent industry spokesperson and serves as the Senior Vice President of NatHealth, playing an active role in shaping healthcare policies in India. She sits on the board of Torrent Pharma and ACC Limited as an independent director, and with her diverse contributions include advisory roles at Baylor College of Medicine and AXA's Global Advisory Board, Amira continues to be a powerful influence in the healthcare sector and beyond. Can we have a round of applause for her? And of course, you will hear from her in some time. Moving on, our next distinguished panelist is Mr. Harish Natarajan. He is the founder and director at HXCO India, the Healthcare Collective. HXCO collaborates with health insurance providers, regulatory bodies, development organizations, and the government to strengthen health systems and build models for better community health and value-based healthcare. The organization works with providers and payers and helps integrate analytics and data science into population health offerings. It also helps innovative healthcare startups to launch and accelerate in India. Mr. Natarajan is on the selection committee of IIT Madras's Biotech Incubator. He has been an instructor with the Gopal Krishna Deshpande Center for Innovation at IIT Madras, and he was the founding CEO of HCL Avitas, an initiative promoted by Shiv Nadar and supported by Johns Hopkins to develop a primary care at scale offering across India. Prior to HCL Avitas, most of his career was spent working for multinationals such as Bausch & Lomb and Baxter in India and Southeast Asia. He's an engineer from IIT Madras and an MBA from IIM Ahmedabad. Mr. Harish's diverse experience of 30 years include other stints in beverages like PepsiCo and paints and agrochemicals. A big round of applause for Mr. Harish Natarajan. It is my pleasure to introduce Mr. Vivek Srivastava, who's the founder and CEO of Healthcare at Home. He's another distinguished panelist for the afternoon's panel discussion. Mr. Vivek is a serial entrepreneur, having started 3 businesses in healthcare and education. His journey began with Nova IVF, which is a health education company based in Berkeley, followed by the Healthcare at Home, which is India's largest out-of-hospital ecosystem, delivering exceptional health recovery outcomes and quality of life, which he has been running since 2012. With a keen interest in investment management, he started the Berman Family Holdings, where he led 6 investments and managed portfolio companies in Berman Family Health and GTI. He has been featured as in the Entrepreneur magazine as Business World 40 Under 40 and Entrepreneur of the Year in the category of healthcare services. Mr. Vivek pursued his engineering in IIT Delhi, obtained his MBA from ISB. He's passionate about fitness, reading, and Bollywood, and is now committed towards solving healthcare challenges related to access, affordability, and standardized outcomes. His vision with Healthcare at Home is to improve the quality of life for all. A round of applause for Mr. Vivek. Mr. Mugul Bagga, he is the currently Regional Commercial Director, India, Middle East and Africa at Medicom Healthcare, which is a UK-based multinational eye care product company. And we are also happy that he is one of our eminent speakers for the panel. Mr. Bagga has over 3 decades of experience in healthcare industry across sectors like pharmaceuticals, diagnostics, and medical devices. Prior to his current experience, he was the managing director at Quest Diagnostics India Private Limited. Mr. Bagga has over 2 decades of experience in commercial leadership roles at companies like Johnson & Johnson and Novartis, and which is why I heard my colleague, and I can see Sean being very happy. Mr. Mukul is passionate about mentoring startups and is mentor, investor, advisor with several healthcare startups. He's an advisor with Willgrow, one of the largest not-for-profit social impact incubator, and with India Accelerator, a startup accelerator. He has also been the visiting faculty at several institutions over the past few years and currently serves on the Board of Studies for Jamia Hamdard University for the Healthcare and Pharmaceutical Management Postgraduate Program. Mr. Bagga has done his graduation and post-graduation in pharmaceutics from Mumbai University and MBA from Pune University. Welcome, Mr. Bagga, to the panel. Our final esteemed panelist is Dr. Dilip Chekuri. He's a biomedical technologist and specializes in application of technology and innovations in the medical device and manufacturing sector since 2010. He started his career at the Pradhan Mantri Swasthya Suraksha Yojana, which is part of the Ministry of Health, Government of India. And he has also other notable experiences as part of the World Bank for Uttar Pradesh Health Systems Strengthening Project and Asian Development Bank Project. He's also being part of the Ayushman Bharat project. From 2017 till now, he's part of the Andhra Pradesh MedTech Zone, which is world's first integrated medical device manufacturing ecosystem, and the Kalam Institute of Technology, which is a Government of India funded technology policy institute, under which he assisted the Bureau of Indian Standards for formulation of 559 medical devices standards and specifications for government e-marketplace, Government of India. Mr. Dilip is presently the CEO for Atal Incubation Center, Niti Aayog, the Medivalley AMTZ, and under his leadership, Medivalley achieved one of the top incubators. He's also the adjunct technical expert for Chairman Technical Committee of Product Linked Incentives Scheme for Medical Devices and 4 Medical Device Park, Department of Pharma, Government of India. A round of applause, please, for Mr. Dilip. And finally, our moderator, Professor Arif Raza. Professor Arif is an associate professor and chairperson for the Assurance of Learning System at the Goa Institute of Management. He has a PhD in healthcare management. Professor Arif brings about 17 years of experience in both industry and academia, making him a distinguished expert in healthcare delivery business and health systems quality. Professor Arif is passionately engaged in advancing the field of healthcare through his involvement in government-funded and international research studies. His work has been widely recognized with numerous publications in reputed journals and through presentations at various national and international conferences. His contributions extend beyond research as he advises the Goa University and several colleges in Goa, guiding them in enhancing their teaching learning systems. Before transitioning to academia, Arif has had a notable career in the healthcare industry, where he consulted for multiple government and private healthcare organizations. He also played a pivotal role in securing accreditation for India's first public hospital, which is a landmark achievement in the country's healthcare sector. He has also authored a book on healthcare accreditation, further solidifying his expertise and impact in the field. A round of applause, please, for Professor Arif. And over to you, Professor Arif, for the moderation.
Thank you. Thanks, Shirupa, for that introduction. And I hope I'm audible to all of you? Yes, sir. Okay, good. So, good afternoon. The post-lunch session, as we all know, is the most difficult session, but we'll try to, do justice to your presence over here. The topic for our panel is Startup Leading Disruptive Changes in Healthcare. We just saw rain disrupting our panel, but we will not let that happen. Thankfully, we just got delayed by 10 minutes, but we are on track. So panel 1 has already discussed a lot about AI ML, and this panel, I would see that is going to extend and add on to the discussion and put a new angle as to how startups are actually solidifying this and bringing it to the table and making it available for all of us. Friends, healthcare industry is going through a remarkable transformation driven largely by the innovative startups who are redefining the ways we access, deliver and experience healthcare. These new stars are effectively leveraging technology to solve complex health issues. They are not just addressing the gaps in the systems, but pioneering new technologies, pushing the boundaries of what's possible and fundamentally altering the landscape. Healthcare is being embraced by startups in large numbers. In recent years, especially post-COVID, there has been an exponential increase in the number of companies who delved into the healthcare. And I'm not saying this just as a passing remark, but there are data to suggest so. As per the media accounts, the number of startups who ventured into the healthcare could be well over 90,000 in current times. For comparison, this number was less than 500 just 8 years back in 2016. About more than 10,000 health tech startups are registered and recognized by Department for Promotion of Industry and Internal Trade. majority of these health tech startups are venturing into the areas such as telemedicine, EHR systems, digital monitoring system, AI-based diagnosis, health data analysis, and e-pharmacies. Several of these health tech startups such as Tata 1mg, Molbio Diagnostic, Innovacor, Pristine Care, PharmEasy, CTS Tech, CureFit, and you can name it, have already made it to the likes of a unicorn. Health tech startups have not just risen in numbers, but also on the kind of impact it is making on the healthcare ecosystem. For instance, thanks to the innovation in EHR, now we can just input the patient ID and you can get all the past and present data, clinical data of that patient. A host of digital technologies powered by AI are now available to doctors for making a better clinically informed decisions. Right? Inside the hospitals, these health tech startups are providing solutions that are providing solutions for better patient engagement, patient data analytics, and managing complicated processes such as insurance claims. Wearables we all know and mobile applications that are available and accessible to all of us had made it much more easier for the patients and caregivers to sort of take a better informed decisions on clinical matters. So be it AI powered digital solution, portable medical devices, or on-demand mental health services, these health tech startups have are revolutionizing the healthcare for both providers as well as patients. Today, we are fortunate to have with us leaders and innovators who are at the forefront of this disruption. Our conversation is going to explore how they are navigating challenges, scaling up their solutions, and basically shaping the future of healthcare. I'm excited about the insight that they are going to share with us, and I would encourage all of you to critically think about how these disruptions are going to impact not just the healthcare industry, but the people and the lives around the world. With that, let's just dive in. So I have planned this, we all basically have planned this panel discussion in sort of a 3 rounds. So in the first, as an outset, we'll invite all our speakers to share their opening remark for about 2 to 3 minutes. Followed by that, we'll have some sort of a discussion on specific points related to this particular topic, and we'll have a concluding remarks, and we'll also keep some time available for the audience and specifically students to ask their questions. So I would request students, there's a very interesting topic, there's a very buzzing topic, so please think about it, note down your question, note down your critical, pointing questions, and when the time comes, we'll move the mic towards you and you will be free to interact and ask questions. They'll be very happy. They've been sharing with me that, they would love to, interact with the students and answer their question, and also get to know as to what is the challenge or what are the issues that the students are facing in understanding this particular topic. So is that fine with all of you? Yes. All right, thank you. So, we all know, we all are witnessing the frenzy that is there in the world of healthcare startups, right? But can we get an assessment of what is the scale and kind of an impact these startups are having on the health ecosystem? And also, if you could share your vision, how would you envision the future of healthcare, considering the kind of innovative technology-based solutions these health tech startups are bringing to the table on a very aggressive mode? So maybe we can move in this direction, and we'll start with Harish, 2 to 3 minutes to you.
Yeah. Thank you so much, Professor Arif, and thank you, Professor Ajay and Professor Parulekar, for having me here. Right, I think it's fantastic. You've got a beautiful institute here, and it's my first time. Hopefully, it won't be my last. Right, but it's really beautiful. So, just before I start, so we've talked about it. Dr. Arif talked about my experience. Right, so I've had 2 kinds of epiphanies in my life. Right, so the first was when I moved from Pepsi into healthcare, and then all my friends used to say, "Oh, you've ruined all the kidneys, and now you're getting into trying to save a few of them." So that was the first. And then the second was, that was way back in 2003. And then exactly about 10 years later, when I sort of actually quit Bausch & Lomb to join HCL Healthcare, they said, yeah, you made all your money out of selling devices and now you're trying to sort of do good to the world. Right? Luckily, I didn't have a third one. So I'm still exactly where I left off with HCL Healthcare. But that leads me to what I believe is the thing. Healthcare, we are at a point of inflection. Right? And we talked about it. The morning panel talked quite a bit about this point of inflection. Right? So on the demand side, people are getting much living longer, right? People are being kept alive much longer, right? And so the healthcare burden is naturally going to increase, right? On the supply side, right, we are seeing a huge gap, And that is going to happen. So, if you, I don't know how much of it you've covered in your course curriculum, but there's always things about how India is hugely under-indexed and we have a 0.7 doctors per million or 1,000 population, and how our number of beds is only a third of what we really need and stuff like that. But the fact is that is out of our control, right? We really can do very little. That's going to take time, but that's really out of our control. The key thing to my mind is about saying, what are we doing to sort of actually do and reduce the burden of the disease? What are we doing to sort of reduce incidence? To my mind, I think that is a key thing, right? So it's not just about saying, how am I going to treat people once they fall ill? It is about how am I going to sort of reduce the incidence of disease? People like, and pardon me, people like Anjanda and I are entrenched in the system for much, much too long. We're there, we're solid. But I really think that this is your generation which is going to make the change out here, right? And that is where I believe that whatever has to happen, it's not incremental, right? Whatever has to happen for us in healthcare cannot be incremental. It has to be disruptive, and it is your generation which is going to do that disruption. And that is where I think I passionately believe in what startups can do in just about every sphere, right? It's not going to be easy, right? Because again, like I said, it's entrenched, right? Everybody needs healthcare out here. It is going to be, it's never going to sort of be easy for a startup to sort of penetrate this entire thing. But however, I believe that just about any walk of life, right? And when Arif asked me this question, I said, it's very difficult for me to enumerate because it'll keep, I could spend all afternoon talking about the number of startups and the number of areas in which they are disrupting, right? Including my neighbor out here who started the first disruption in 2012. And frankly, he's still disrupting. But 12 years ago, when HCIH first started, right, it was a completely novel concept. Our first thought was to say, hey, what, will a hospital really give up part of its revenue for a company like Healthcare at Home? But they're here 12 years later, growing, right, exponentially, and that should itself be a measure of some confidence to the rest of us as to what startups can achieve in this world. Perfect segue. I'm going to leave it now to Vivek to sort of take us forward, if that's okay, or unless you have another question for him.
No, thanks. You very rightly said that, it has to be entrenched and, it cannot be incremental. It has to be disruptive. So thank you very much for sharing that. I'll go to Vivek and, you could share based on your experience and your vision of future of healthcare.
Thank you. Thank you, Professor Arif, and thank you, the gym management, to get me here. It's always great to visit Goa, and if it's funded, it's even better. I agree with all the points which Harish said, except for that Anjanda has, it's young at heart still. He'll continue to lead, for the next many, many decades, all the changes which are happening in healthcare.
Don't say anything about me. I'm with them.
Yeah. He said he's a student, right? But yeah, coming to healthcare disruption, and thank you for your kind words about our organization. Over the last 10 years, Professor Arif talked about the kind of number of startups which have come in. So in the last 10 years, India has seen health tech startups getting investment of about $7 billion. Last year itself, it was about 680 million. So there is enough and more action continuing to happen, and the future, it'll continue to happen. And we heard that in the first panel itself. I think from my point of view, and there are many things which will happen in the future, but I'll just pick one thing. In my view, future of healthcare is outside of the hospital, right? Like Harish mentioned, there is preventive, or preventing the people to get sick, which typically will happen outside of the hospital, not inside the hospital. And then how can you, besides saving that life or acute intervention, health is very large, right? And health, that's sickness management, but health itself is managing it without becoming sick, or even if you get sick, come out and manage your health, effectively. And a lot of disruption will happen in that space. It continues to happen in that space. And I think more and more, the way the technology is developing, right? We were talking of being very individualistic or personalized medicine and so on. All those things will lead to more and more technologies which are for that individual, whether it's using wearables, whether it's using AIs, whether it's using other kind of technologies. But it's more and more that individual, what is that individual needing? So all disruptions are moving towards in that direction, not generic, but very specific. And particular to India, it was there in my introduction as well. India's healthcare suffers from three, problems in my view. Access, which means even if people have money, they could not, access healthcare. Affordability, even though we are the cheapest healthcare, in the world, still there are, people who fall into poverty. 50% of all people who fall into poverty fall because of healthcare expenses. And standardized outcomes, which means people, you will get the same surgery or anything else, but the outcomes will vary from region to region. So if you are able to solve these problems, those will possibly address a lot of India's challenges and address the, under indexation of capacity as well. That if you take, patient load outside of the hospital, then you can service more patients, because you can't create so many doctors, you can't create so many hospital beds. You have to do it in, disruptive ways. Thank you.
Thanks, Vivek. I think you rightly said these complex issues of access, affordability, and quality of care is something which the world has been struggling for a very long time. And thanks to the new technological solutions, the access part, quality part, affordability part, all three are getting addressed, and that we are seeing live as an example through many things. And you rightly said that, probably the future lies outside the hospital, not in the curative, but more on preventive wellness, those kind of a thing. I'll move on to Mukul. Could you please share your views also on that?
Good afternoon, everybody. Still post-lunch blues are around, but hopefully discussion will excite you and wake you up a little bit. Thank you, Anjanda, and faculty of GIM for inviting me over here. For me, it's like a homecoming because I have my alumni of Goa College of Pharmacy. So not GIM, but some kind of a connection with Goa is quite deep. So always a pleasure to be here. My second time on the campus. I was here in 2019. So great to see the growth and the kind of students and the infrastructure which is kind of improved significantly. So all the best to all of you for your very bright futures. You mentioned about scale, so I thought, maybe I could touch upon that a little bit. So I'm sure you all are aware that the healthcare industry in India is currently valued at about 180 billion, which is all the sectors put together. And as per some analyst reports, it's expected to go up to or double in the next 5 years. So that's a significant growth for any sector, right? And you guys are in the right place at the right time, making careers in this industry. One of the key drivers for this growth is going to come from innovation. So, which is of course, the topic of our discussion as well. So innovation is going to contribute, which is around 30 billion now, is also going to double. So from 30 billion, it's going to go up to 60 billion. So where is this innovation going to come from, and which sectors are going to contribute? So currently, healthcare is dominated by pharma services, vaccines, right? If you see around you, this is one of the sectors which kind of dominates. India has gained a lot of recognition around this, right? But the medtech sector and the health tech sector, that means all the AI-driven services, the disruptions we are seeing in the pharmacies, in the Tata 1mgs, in healthcare deliveries, all the bot technologies, all the AI-driven radiology technologies, these are all the sectors which are going to come together to drive the rest of it. So that part of the sectors which were maybe 10%, 5% earlier is expected to go up significantly. So that's the area you want to think about, where you want to make your careers, etc. And maybe we'll talk about it a little more as we progress. So I'll hand it back to you.
Thanks. No, in fact, the numbers are quite amazing and exciting. They run in multiples of billions, and which is just going to increase as our demographic dividend also we have. So there is nothing to worry about the market growth and the potential. Yeah, but the change is really the constant basically. It is going to be changing. We are already saying that changes are happening, and these numbers which Vivek and Mukul has already quoted are sort of giving more confidence on what is probably going to happen in the future. Let's on move to Dilip. I know you've been working with startups for quite some time, so would you share your views on that?
Thank you, Professor Arif. Hello, everyone. It's a nice feeling to be here. Thank you so much for gym management for making me to be here. It's always a good feeling when I see young people who are the future of our country. And if I talk about as a country, we are moving in a right direction. You know, the National Biopharma Mission, Atal Innovation Mission, these are the initiatives by Government of India which started 10 years back approximately, and that's why we have platforms like, you know, Atal Incubation Centers, BioNest Incubators, where these startups are coming, getting the platform, because when I passed out from my college, there were no startups or incubation centers where I can really work on my idea. So it was up to the papers, you know. Now this is where the initiatives like this are making giving access to these platforms where you can, convert this idea into a product, where you can actually do the disruptions in this medtech area or the health tech. So, so in this direction, there are several startups who will be I'll be talking about, whom we have supported, and also the students here should think, if they have idea, you should translate to a product. That should be your focus. Thank you.
Well, thank you. Okay, so just to check, do we have Miss Amir Shah with us? I could see some name over there. Any student volunteer? So Ms. Amira is also there in the panel, and she, due to some personal circumstances, she had some time issues. So she would be joining very soon with us. We're just checking if she is already joined. Okay, but she will join. She has communicated that she would be there once she gets done with her personal engagement, and she would be sharing her perspective on the topic. So as and when we wait for her, she's built one of the most successful startup or a company, Metropolis, as you would all know. So it would be very interesting and from a learning point of view as to how such kind of an organization could be built. Okay, so I think we could now move on. I think the introductory part gives us an idea that yes, the future seems to be that there's a lot of demand, there's a lot of healthcare which is going to happen, but not in a way which we have been used to. The conventional or the traditional method may not apply as it is the way it is going on. There are definitely going to be changes. So I'll try and pick up their brains more on what are these specific changes. So best thing to understand this kind of, it is a little bit hazy, startups, we all understand startups are happening, but what is it? What are these startups? So best thing to understand is to get some examples, right? So maybe I'll request Mukul. He's been passionately involved in mentoring and helping the startups in this particular area. And then later on I'll come to Dilip because he also has a lot of startups, in fact all of them. But let me start with Mukul. Could you share some unique and concrete examples of some of the disruptive innovations from healthcare startups? Either those already exist or we can expect them in near future.
Right. So tell me, in the last 5 years, which is the one event you think has impacted economy, politics, geography? Yeah? So that was one of it's a healthcare crisis, right? Not a tsunami, not an earthquake. No, it's a healthcare event which has shaken the world. And that one healthcare event, how did it get solved? If you have to name one word, in one word. Vaccine, right? And where was this vaccine created? So it was created by a startup. It is the innovation of a bunch of people using certain technologies which ultimately got channelized into a product which then reached out to the world and created or found a solution through this crazy crisis we went through those 2-3 years, isn't it? I'm sure you have all heard of the companies like Moderna and BioNTech, which partnered with Pfizer, and they created the mRNA vaccine. Of course, we had our own Indian companies as well, which did that, Serum Institute and Bharat Biotech. what's the technology which was behind these vaccines? Anybody knows? Yeah. Of course, these were the ones in the US were mRNA vaccines. The technology was something called as CRISPR. Have you all heard of CRISPR? Don't ask me to give you a full form, but that's the technology which basically is all about gene editing, right? So this technology enabled these vaccines to be created in a record time. We know that. Within 1 year, it was a completely unheard of, situation. And this technology was, CRISPR technology, was acknowledged by a Nobel Prize to the founder of this, the discoverer of this technology, the lady Jennifer Duana, and and Carpentier. I think they got the Nobel Prize of Chemistry in 2020. I hope some of you have read their book, Code of Life. Yeah, it's must read for anybody doing healthcare. These are the kind of real life examples which will really inspire you as to what technology can do. And it's not about talking about innovation at a small scale. This is the impact of innovation, global impact of innovation. I'm just giving you all that as a scale. Then maybe we can talk about other things as we go along. Of course, there are a couple of other examples. Maybe if I can quickly share them with you. Have you all heard? So what is the next healthcare crisis you see around you? Which is that one healthcare condition which has resisted all attempts of scientists? Sorry? Okay, yes. But I would say MDR is a little more, let's say, country specific or localized. Something which is more cancer, right? I think that's the universal word which strikes fear in anybody, right? And it's the same problem all over the world. Technologies may be growing more or less, but they are all trying to find a solution to this. And one of the recent breakthroughs, of course, it's right now restricted to a particular segment of cancer, which is CAR T-cell therapy. Again, driven by this CRISPR phenomenon. So these are the kind of disruptions which are happening. And I don't know if you're aware, but CAR T-cell therapy, now we talk about innovation in healthcare and we think that all this innovation is only happening in the West because whatever access to funds and technology they have. But such a path-breaking technology, is it possible that it there can be an Indian company discovering it or being part of it? Are you aware? So there is an Indian company which has also created and launched its own CAR T-cell therapy. And this is again a very amazing example. I just want to put it in context. A partnership between academia, incubated at IIT Mumbai and Tata Memorial Hospital. The industry. Not industry as in, say, the for-profit industry, the not-for-profit industry. Tata Memorial, as you know, is a trust hospital. Right? This kind of amazing innovations, and see the way and complexity of getting this all done. If you all have a chance, read about it. How much effort went behind creating this whole treatment. There are others now following, but the point is that this kind of disruptions are really now set to grow and not restricted just to the West. There are now opportunities for these kind of innovations to happen in the country as well. I attended a talk by the CDSU head, and he was telling us, just by way of example, that he has got at least 10 gene editing technologies right now under process of approval with the CDSU. So you can, and these are all Indian companies, not multinational companies trying to launch them in India. So that's the kind of innovation and disruption which is happening. And very exciting to see and exciting for you guys also to be part of in the future.
Thank you. Thanks a lot. Quite a lot of interesting examples that you shared. CRISPR, as you rightly said, I think they also have been approved for sickle cell anemia treatment as well. Yeah. So
that's a
gene editing model one. Right. Good. So what you, Dilip, also could you also share?
Just to add to what Mukulji has said, during the emergency when COVID hit us. So as I come from AMTZ, which is Andhra Pradesh Medtech Zone in Visakhapatnam, the southern part of India. We were ready with these plug and play manufacturing units, and common scientific facilities where these labs can test every technology as per the international standards. And we were ready. We were not aware that we will be hit by this emergency, which is COVID. And a company from Goa, Mole Biodiagnostic, is our partner. The one of the largest facilities in AMTSAT. During that time, because of the infrastructure available and the scientific facilities for testing these diagnostic kits, they have really covered the requirement of the country. The 80% of the COVID diagnostic kits, which is RT-PCR kits, went from AMTZ. And that's a unicorn now. The medtech company from India, which is from Goa. So this is what, when you give startups a good chance where you can give a platform where they can showcase their work. That's how they work. They have shown their work in COVID. So there are several startups like India Health Link, which through telemedicine, they can help the rural part of our country, where this kiosk can do 65 parameters. I think we have Amira. I think we should answer because of the time constraint. You want to take it up?
I think that's, thank you. Thanks. Yeah, you can keep it here. Thank you. Thanks very much for the insightful examples that you share. And I think Ms. Amira, you joined. Hope you are able to hear me. Not able to hear. Okay. Hello. Can you unmute yourself if it is possible? Is it
yeah, I just unmuted myself. Thank you. I was not able to earlier.
Sure. Yeah. Thank you. Thanks for joining in. I know that you've been grateful to us to take out time from your personal busy schedule. I know how busy you were with your personal circumstances. But we have been discussing about, and we took an opening remark on this particular topic of, we are discussing on healthcare startups and how they are disrupting the healthcare landscape. And considering that you might not be available for a longer time, may I request you to share your opinion on what is the kind of impact and disruption these healthcare startups are bringing to the industry, and how would you envision the future of healthcare? Please take extra time and share your perspective in detail.
Thank you so much, and so nice to see all of you. And apologies for being late. I think healthcare is in a very interesting sort of pivotal point at this juncture. And, while I think there is a lot of excitement and enthusiasm in talking about disruption of an industry, my opinion and thesis is that actually healthcare will be best disrupted from within and not from outside. And I'll explain what I mean by that. Often when people look at industries, they feel that, okay, if some, startup starts something new and innovative, it will come and completely change the way things work in an industry. And that happens in some industries where consumers are the key decision makers and market trends allow those decisions and trends to make changes in the way we do things. But healthcare is an industry which is fundamentally based on trust and credibility, and that to trust and credibility with the doctors. Because without trust and credibility with the doctors, you actually can't go very far in healthcare. Now, to build that trust and credibility is incredibly hard, because you need to be not only exceptional at what you do, you need to have a subspecialty expertise at what you do, which is what makes the doctor want to work with you or want to prescribe, your tests or your products or your services, whatever they are doing, right? So often I feel I have seen over the last now, I would say 10 to 12 years, I must have at least mentored 100, startup founders in healthcare. I would have seen a lot of their journeys. And I can tell you, unfortunately, what I find is that a large number of them don't land up succeeding. And there are 3 top reasons why they don't succeed. And I'll tell you who are the ones who actually succeed as well. So the top reasons of success are where they recognize that having a product or a service which looks and feels different in healthcare is not enough. And finally, technology alone cannot win the game in healthcare. And they actually have to focus on what is the value and the need that is being fulfilled in the world today, which today is not fulfilled from a patient's perspective. The second thing they realize is I have to go and get the key influencers in the industry to support me, which are the doctors. But I have to do that in a way which is truly based on science and expertise and not based on commerce. Because the commercial route is a slippery slope. And honestly doesn't take you, to any financial success, and it will take you down sort of an ethical, lack of success as well. And the third one are the ones who say that, look, I'm not trying to completely change, but I'm trying to align. I'm trying to work with industry to actually solve a customer's problem. And usually the chances of failure are high when it is approached from a mentality of saying, look, everything today is broken. Healthcare is broken. Healthcare is not working well. And we have to come in and disrupt it. I have found that mindset actually not succeeding so much in healthcare because the success is more happening when you're working with incumbents to actually change the paradigm of the game, because the incumbents, the good incumbents, have trust and credibility of the doctors. What the startups are bringing in are innovation, new products, new ways of doing things, tech enablement, which the incumbents don't have. And the combination of these two, that partnership, is actually what is driving great change in the industry. The startups that go on their own and incumbents who go on their own, I believe, will be less successful. But the coming together of these two can really, truly transform healthcare over time. And I'm a big proponent of bringing the new with the old to really create a concoction that truly adds value at the end of the day to the patient and to the doctor. So it's been very exciting journey, I think, to see, a lot of the startup founders, some fantastic ideas. But often I find that, those fantastic ideas don't see the light of day, and they stay very subscale or very small because they don't have a platform to go from. And to win the trust of a consumer or for a doctor is so difficult that it takes years to be able to do that. And in that time, without doubt, there will be some funding winter or something that happens that actually then kills the prospects of building something. So, some of the startup founders that I work with, we sort of try to offer them a platform of saying that, look, can you, work with an incumbent, try to see if you can have access to their customer base to sell your product or service, try to find that combination of partnership that it's a win-win for both, and that truly will be what will help you to really take off. Don't let this be a lonely journey. And I found that when some startup founders have taken that input and built something, they've actually landed up becoming even more successful, in the long term. I'm looking at businesses today, which I'm quite amazed. I mean, I would not have necessarily guessed, that these businesses would, or these products would do so well. For example, I saw one Vertigo diagnostics business, which is actually scaling quite well. I've seen some very interesting, what people call as AI sort of led products. We still have to see how much AI is there, but AI-led products that are allowing a complete way of changing the way PHCs are run, primary health centers are run, where the need for doctors are much less. You can do things more with other kinds of medical faculty, and therefore really reducing the need, for having a doctor physically present at all times, but maybe having a cloud doctor there as well. So I think there are some very innovative ideas that are coming forth. And personally, I'm working with a bunch of startup founders to really assist them, either through mentorship or with, like I said, giving them access to a platform to really help them scale their businesses. And personally, for me, has been a really fulfilling last many years to be able to do that, and really keeps me learning from a lot of these startup founders about how to look at the same industry that I've been in for 24 years, but how to look at it from a new lens, from a new eye. And that really gives a new perspective to the same industry as well. So very excited for where it can go. Having said that, there are some gaps and voids for startup entrepreneurs today. There are too few incubators and accelerators in the industry. That's the first challenge. Everybody has to work on their own. I think if we had more accelerators and incubators, it would certainly help the healthcare industry. Second, I think is existing businesses like ours at Metropolis, larger businesses, to have programs that allow for startup founders to work with us in a more easy to way to work, to do business that will help both companies. So I think that's a second, that's definitely a need of the hour. I think the startup funding and financing continues to remain, in cycles, right? Depending on, how the market is doing, etc. But healthcare being a much longer gestation business, it is not like consumer or fintech, which can take off much quicker. but takes much longer, like we said, to earn that trust, and therefore they need more patient capital compared to the typical cycle of VCs who are looking for very quick milestones. And I've seen how those very aggressive milestones of VCs and angel funds can sometimes land up spoiling the journey of a startup company. Because initially, while you need to be building that trust and credibility, the focus is going too much on users and active users and how many people are on your app and how many people have you acquired, etc. When really the focus of healthcare is completely opposite, which is to say, build a fantastic product or service, make it a thing which is really needed in the world, get people to like it, get people to respect it, and the financials will automatically come. So I find often it's the reverse of that, which actually harms the company rather than benefits it. But those were just some thoughts, and very happy to answer any questions, if anything.
Thank you. Thank you, Amira. I think you have touched upon the entire spectrum of the things that a startup in healthcare need to consider, not just the idea or innovation, but how do they build synergies, how do they kind of find solution, how do they take it to the market. And good, you also spoke about the challenges, because that was one of the questions that the panel is supposed to answer. So moving on, I hope you would be able to spare some more time so I could get back to you again in some while. But let me now move on again back to Harish, and could you, in your opinion, so could you talk something on the gaps or the pain point which are there currently in the existing healthcare, and how these startups are sort of trying to address them? So what are the more important pain points that are there? Can you go a little bit more specific?
Sure.
on
So
that?
I think Avira already touched on some of the external pain points,
Yes,
right? So we're talking about the need for patient capital, recognizing that the horizon in healthcare is going to be much longer. So, right. So if you talk about fintech, you talk about consumer financing, or you talk about consumer, you're possibly talking about a 3-year horizon. Whereas in healthcare, you need a 15-year horizon for you to sort of actually really look at that. So one is patient capital. She talked about the incubation and the need for incubation, right? And the need for many, many more incubators out here for you to really look at. The entire partnership between, say, the healthcare providers and the influencers with these, with startups. So that becomes an integral part of all this. So that's really part of the external challenges which most startups face. I think there are also some internal challenges, and I think the panel this morning actually brought it out very, very clearly. Yeah. I think one of the key things for me, when you talk about an internal thing, and it's more than a challenge, it's a realization, right? That that most startup founders tend to believe that they are building a product, right? So they come from very technology backgrounds, they come from sort of disrupting it from a technology standpoint or stuff like that. They're building a product. But here in healthcare, like Kalyan talked about it, right? Nakul talked about it, and Giri talked about it. So everyone talked about the fact that in healthcare, it's a question of saying, hey, how are you going to challenge the existing status quo? And how are you going to weave yourself into the way things are being done today? For example, now if I really look at, right, if I say, hey, this is a cumbersome way in which you're doing something today, right? Several of my saying, let me take an example, for example, right? So if I talk about one of the biggest killers in India is cervical cancer, right? Now, typically, if you look at cervical cancer, right, what do you do? So you have a HPV test. I mean, first of all, you have pap smears. I don't think many people in rural India even do pap smears. If they really go from there, you sort of actually look at something abnormal in a pap smear, you do an HPV test, which is only available through the gold standard for that is a Roche Cobas, which is available in a few, but not many laboratories. And then if you still believe that there is something happening out here, then you need to go for a colposcopy, which is an invasive procedure, right? If I can disrupt that, and so one of the startups I'm talking about is saying, hey, you know what, we're going to disrupt this. There is COVID. What COVID has done is created a whole bunch of capacity out there for PCR. So they are developing an assay to say, like, listen, we'll use PCR. There are 100 Roche Cobases possibly in the country. There are 4,000 PCR apparatus out there. Can we use PCR as a primary method for HPV? And then that's the first part of it. Look at how they're disrupting the entire cycle, right? The second part of it then is to not just keep quiet there. It is also about saying that, how do I prove to these doctors, coming back to what Amira said out there, how do I prove to doctors who are my primary audience that I'm not compromising? That, so especially when you talk about this, right, there is this whole concept of specificity, right, which is how many false negatives are there. So doctors are very, very worried about false negatives because they can't. If you sort of actually bring them 20 patients who don't have a problem, that actually increases their workload. So how do you improve the specificity of the solution? Then that comes down into saying, how do I, in a very structured manner and in a very disciplined manner, how does a startup kind of put that to trial? Now that whole process is something which has to be managed very carefully. So, and there is again, I would really think that I would tend to agree with, I was being very flippant when I said, when I talked about Anjanda and I in the morning, I mean in my earlier comment, but I really think that there is a need to sort of mesh in this entire thing, right? Need to mesh in what's already entrenched and try to see as to how am I going to weave in these new solutions in a manner where they sort of actually are able to disrupt it in a positive manner.
Right, yeah.
You know, so that's to my mind a very, very key thing. Sorry, if I can take a minute or two more. So for example, I really think that when I sort of work with startups, right, and we'd spend a lot of time and people think I'm being nagging, right, but the first few questions, which Amira was also sort of referring to, which is all about saying, hey, what's the problem that you're trying to solve out here? How is that problem being solved today? What gives you the sort of actually confidence that your solution is better than the solution that already exists out there? If you cannot answer these questions, right, I don't even think you should be going to the next stage, right?
Yes, of course.
So that's to my mind my thoughts. I'm conscious that I'm hogging the mic, so I'm going to
Thank you. We'll get back to you again, Harish. Thanks for going into the specificities of what are the gaps, and I think I'll ask go to Vivek also. You've built 3 serial sort of entrepreneur and all into healthcare. So what are these sort of pain points or gaps that you observed yourself, and you decided, okay, this problem need to be tackled with? And what are the similar that comes to your mind, maybe future ideas for the students?
So I think I'll again go back to the fundamental problems of healthcare in the country: access, affordability, and standard outcomes. All what we are, what most of the organizations, even the AI organizations are trying to do, for example, was how can we have, through a cough mechanism or through mechanisms in which otherwise this kind of facility would not be available. You are able to use technology to be able to give this access. No radiologist in certain towns, but now you can have the machine and the radiology, diagnosis happens. So access, is something where a lot of action is happening. We do about 100,000 screenings on a monthly basis with a device which can move around and do liver screenings, and about 60% get diagnosed with some disease, which may not, but that's something which otherwise we would not, you would not be able to diagnose at all, right? They may come to a point where they are at a stage where you have to have acute intervention. So access. Next is challenges of affordability, which needs to be solved, because India will, while our average per capita income is increasing, we'll have to consistently solve as to how do we get the affordability. And how does that happen? One, if you are able to reduce the super specialist work to a specialist work, and subsequently go down, so that you are able to reduce the cost per transaction, and using technology and scale take it to far and wide, hence reducing the cost. And you can have variety of technologies and service provision to be able to deliver this. So affordability. And again, technologies as well as standardized processes to be able to give outcomes consistent despite who's servicing. One of the challenges of healthcare, which all the hospitals also face, is that there are star doctors, right? A doctor moves, the patient pool moves. How can you not have dependence on individual brilliance and have more processes, right? So more make it McDonald's-like, rather than make it an Oberoi burger which is done by a sous chef or a chef, star chef. So for example, in our organization, we are able to predict outcomes as soon as the customer comes in, and those outcomes have been 96% accurate, whether the therapist is A or B, whether it is Bangalore or whether it is Delhi NCR, right? So that system, because we want to make it McDonald's-like, so that you can scale with process and technology and not depend on billions of individuals, right? Because that's scarce, something which you have already touched upon. Scarce commodity in India, having talent.
Sure. Those are very important points. So I think I'll skip a couple of questions which seems to be have answered, and something which I think Amira has also touched upon, and Mukul, you've been working and advising a lot of startups. So I want to understand as to while these startups are introducing a lot of innovative solutions, and their practical implementation may face certain kind of a roadblock. So could you throw some light on, what are some of these primary challenges these are encountering, and what kind of a solutions also could be there for that?
Yeah, this is again a little bit of overlap of the earlier discussion.
Correct,
so
yes.
I would say the biggest challenge for these startups is access to risk capital.
Okay.
Right. So while these funds are growing, but I'm just giving you a context that investment by private equity in healthcare, suppose in the US, is around 30 to 40 billion. In India, it is less than 2 billion. Right. So the scale is very different, and government is stepping in with things like BIRAC and the bioparks kind of setups where they are trying to provide some kind of grants and let's say access to funding. But they are very few and very little.
Right.
So that is one of the biggest challenges. The other ones, I'm now talking some more practical things. For me is the opportunity in India is sitting out in the larger population, which is in tier 2, tier 3 cities. Right? The tier 1 cities still have got access to good quality healthcare, like Vivek was talking. So this access challenge of tier 2, 3 cities is currently the only way to access it is through the public health system, isn't it? And if the public health system doesn't have a mechanism to partner with these startups, or give them access, or give them the opportunity, then it's a huge loss. I'll give you a small example. There's a company called Bimpu with whom I worked with. So they had come up with a very interesting innovation, a temp watch, which is a kind of a bracelet, which is put on the arm of preterm babies. So India's incidence of preterm death and child mortality is among the highest in the world. It's 4 times what it is in the US, for example. But is this happening in the cities? No. These deaths or this terrible rate is magnified in the tier 2, tier 3 cities where they don't have access to good quality nursing homes, etc., etc. And where the public health system is the only way, the primary health care centers, the sub health centers, or whatever, right? So this wonderful innovation, he knocked the doors of every state. Every state welcomed the innovation. So the innovation was that when you put the bracelet on on the child, if there was hypothermia, which was one of the largest causes of death, right? The temperature falls, maybe there's a fan, maybe the baby is in the open. These are typically children of workers who go off to work. They can't afford to be at home and take care of the child all the time. So the baby is left lying somewhere in the open. If the temperature falls, the bracelet starts beeping. So you have to give that child what is known as kangaroo therapy. Just put body warmth on it and it's like a lifesaver. But because this is missed, a lot of child mortality happens. Sudden death of the child, nobody knows why it happened, right? So this innovation could have saved so many lives if the public health system had taken it up. But these guys knocked so many doors. And today his biggest customer is who? UNICEF. So UNICEF is selling them to Africa, to countries in Asia, to underprivileged people all over, not in India. He's not sold a single one in India. He tried selling to private, but obviously private is not interested. So what I'm trying to say is this is where this is the challenge. This is just one, I would say, acute example. There are many more like this, where the innovations are there, designed to create better access, better affordability, but they don't have the opportunity. And the last one, maybe I amplify a little bit of what Amira also mentioned. Access to the established healthcare organizations, right? Many of these companies, the diagnostic companies, the healthcare service companies, medical device companies, if they give access to these innovations to partner with them, that could give them not only monetization, it could give them a learning curve, it could give them mentorship, and it could give them scale for their innovation. but the barriers are so much, the bureaucracy or whatever you call it. I have seen them really, trying their best but getting very little access. Some of them do make it. We did hear Amira say about 50, 100, she's mentoring herself. So maybe somebody has to get into that very kind of, I'm not saying her, but many of the others around it. Vivek knows I have been knocking his door for a few of them. So opportunities are there, but the industry has to be more open to this. Because all the executives are busy, they are consumed with their own work. That we understand that, but that's the kind of a barrier which sometimes these startups face. And if I may just mention one more, and which again Harish was alluding to, but if I can put it in a word which is very dear to my heart, because I think that captures the real challenge, is the go-to market. Most of the innovators are tech entrepreneurs and very good on technology, but they don't visualize the scale up of their technology. The whole commercial is not properly, they don't visualize it. The medical advocacy, I think Harish also mentioned, Amira also mentioned, this has to be well thought through, this has to be well planned out. It's an orchestrated process where you do the clinical trials, how you create the scientific evidence, etc., which multinational companies have mastered, the bigger companies have mastered. The startups don't know this. And this is where the industry mentorship really helps them to show them that these are the things which are possible even within your limited budgets. And that's where working with accelerators like India Accelerator, where Anjanda and I are on their mentorship panel, we really find these as the glaring needs where we could contribute.
Sure, good. So yeah, so access to risk capital, reaching out to the tier 1, tier 2, tier 3, someone which is going on, go to market. Yeah, we got a sense of what could be the challenge. And I think, so I'm also keeping a time, my watch on the clock. I request, I think because our panel started 10 minutes late, so we could continue because we also want to take students' question. So what I'll do is that maybe I'll take one question from Dilip and then I'll also extend that question to any one of you. And then we'll start question and answer round. So I hope you all have penned down your questions and please bombard, we'll take it as much as possible given the time limitation. So now you discussed a lot of point on the problems or the challenges. And we all know that the disruptions are actually good. So there are a lot of solutions which they are bringing. And also in the public health sphere, also these problems are being solved. So if these challenges has to be overcome, there need to be some government intervention and policy support, right? So I think, could you throw some light on what are some of the government, is there some government, are they enough? And if not enough, what are the things that need to be done from a policy point of view to support these startups?
So major challenge the startups face is the regulation part of, for the medical technologies. Okay. The CDSCO is a regulator of India for medtech and drugs. So that is very complicated. If it can be simplified, that's why the government of India has initiated medtech Mitra. It's a platform where you register your queries and directly from the regulators, they will answer your, whatever the queries you have. This has been initiated 4-5 months before. So it's a good platform. We can see many innovators or startups come with their challenges in regulations, or if they want to know where to scale up and get connected to the investor. This is a platform initiated by medtech Mitra by ICMR and Niti Aayog. Okay. So where you can directly interact. So you just register and they will take your queries. So this is where many queries has been resolved. And this is the one initiation done by government now.
Okay, okay. I would like to add on something as to what could be the additional support that the government or policy should, any ideas on that?
See, I think all the policies of government as well as payers are very, very specific to the hospitalization sector, right? And insurances, etc. He's been trying to move the insurances. Sir has been trying to move insurance, and he's been able to move, some of them. I think if we are able to get the payer mechanism worked in such a way that it incentivizes not the costly part, which is inside the hospital, but outside, so that you're able to either prevent or reduce the cost, whether it's using technology innovations or otherwise. Currently, the payer mechanism is not there at all, right? If you have a surgery, you'll get paid for by the government institutions or, or the insurances, but otherwise there is no regulatory, support outside. The second thing is a lot of awareness needs to be created. Like for example, during COVID, an awareness got created that everything should not be taken to the hospital. We forced into it, right? That's why we were able to handle 20 lakh patients in COVID. Imagine if they would have gone to the hospital, right? What would have happened? We were already, shattered in terms of the hospital infrastructure. So awareness of either managing your health better, right? And investing a lot in that rather than investing more in, or simultaneously more investing in the infrastructure, but investing in making people aware to do the right thing, which will, prevent the loading of the, infrastructure which is there in the country. So those are the 2 points for the government, I would say.
So let me just amplify on one point which Vivek has said. Say, so the one thing about, we talked about BIRAC, we talked about all the government activity and stuff like that. What would really help to my mind is if there is a way of harnessing this thing. Say, for example, we talked about startups, right? You have 200 startups, only 5 of them will be a commercial success. But I'm sure about 100 of them would have got to some stage and they would be able to provide some resources for somebody else, right? If there is a transparent one, it's in terms of some kind of registry which allows us to use the work of that one. That's one. The second is in terms of startups getting a level playing field. We talked about data sets in the morning, right? Now, data sets somehow have become a preserve of the large company, right? But if you really look at, I think, if you really look at startups and young people getting, access to these data sets, that could be it could potentially go into a completely different thing. Third to my mind would be is in terms of, say, and this is something I'm going to digress for a minute and talk about the renewable energy business. Right. So somewhere along the way, there was a recognition that, hey, solar energy today might cost 2.5 times that of fossil fuel energy, but I know for certain that this is my future. So I'm going to invest in it, not for now, but I'm going to invest in it for the next 14 years, 15 years. And what happens because of that? Because of that, what happens is that your solar panels get cheaper, right? You get scale economies and whatever it is. And what started off at 15 rupees a unit is now, say, 5 rupees a unit. Now that's the process. It's not going to happen overnight. It has to happen over 15 years. But then there is somebody, like you talk about PLI schemes and like you talk about bridging this gap, there has to be a very concerted way of bridging the gap until we find that these scale economies are actually resulting in something positive. I don't think that kind of intent we are seeing yet. And that is something which I would really welcome.
Thanks. So there's a lot more question on my list, but I think we got a sense. And I think this is a topic which is sort of an endless. I think we can work for the entire evening and we'll still have discussion and examples going on, because every example, every project is a new, from a technology point of view or a management point of view or connecting point of view, solution point of view. But as promised, I think we'll now like to go towards the audience and, so you can show a hand, and can I have some student volunteer who can move on the mic? Okay, go ahead please. Mic please to her.
Good afternoon, sir. My name is Kamakshi Jangid. I'm from HCM first year. So, as you mentioned that instead of depending on individual brilliance, like when doctor moves, the patient moves. So, instead of that, we should focus on improving the processes of organizations. So, but people have a very strong faith on doctors, and no matter how much we develop on AI, it cannot replace doctors. Also taking into account
Can you keep the mic closer?
Yeah. Am I audible now?
Yes.
Yeah. So should I repeat the question?
No, continue,
okay.
Yeah.
So we cannot, with AI cannot replace doctors. So can you throw some light on how we can improve the processes and what exactly should we focus on, so that if a doctor moves from our hospital, he or she should not take away our patients or say our customers?
So I think Anjanda in the morning talked about healthcare has care, right? Care requires personalization, right? So personal touch, empathy, etc. cannot be replaced by any technology ever, right? So So that I completely agree on. I think the thing is the processes in such a way, right, that, so for example, in our organization, right, we are able to handle an HDU equivalent patient, step down, I'm assuming you all know high dependency unit, which is one level below ICU, or we were able to do ICU at home without having an intensivist physically present, right? Which means you were able to set the processes in such a way that you are able to manage a critical patient, but you don't require the physically present individual, and yet are able to give the outcomes. Same is the case with therapists and other professionals, that you are not requiring that individual alone, but just by processes and training, you are able to set that if A happens, then you have to do B, and so on and so forth. This could be done through process, or this could be done through technology, to be able to deliver standard outcomes. McDonald's does that. Fryer mein aapne fries ko dala. After the cutoff time, the fryer will stop. It will not be dependent upon swadanusar, right? So it will be dependent upon the machine. So you don't need a chef, Sanjeev Kapoor, to time it out. Same is the case in case of a McDonald's burger, right? So they have standard patties, standard buns coming in. A 12th class pass is executing it. And if you eat it here, if you eat in New York, you'll get the same output. That's the process dependence. That is the process. And that's when you scale. That's why McDonald's is able to scale. And Oberoi is unable to scale. It will not be able to reach to every nook and corner, right? That's the difference. So dependence, individuals will always be there. How can you put technology and process to reduce the dependence on people's high skill set? Now radiologists should not be top shot, and hence they can, a system can just give them the report. Signing, medico-legal responsibility today still lies on the radiologist to sign it off, right? So that's how we'll have to change things.
Right,
Thank you so much.
So answer lies in standardization rather McDonaldization of healthcare.
Yes.
Okay, anyone else? Okay, here I think. Okay.
Shweta Krishnan from HCM1. So as you mentioned, the temp watch, which was used to reduce the mortality of neonates. So to propose the value proposition, what would have been the best method for the government or for the private providers? Or would it have been better if the healthcare providers had directly provided the watch directly to the consumers, or if it had been propagated through the insurance companies?
I didn't quite get your question, but if I can rephrase it, that what could be the alternative ways to make this temp watch more accessible?
Yes,
right?
the proposition, the value proposition, how to best deliver it to the...
See, the problem with the temp watch was that the need which it was fulfilling was not in the affording population. It was in the non-affording population. These were people, the temp watch cost, after all the changes, say 500 rupees, right? But not those daily wage workers where the incidence of preterm birth and these problems are there, they can't even afford that 500 rupees, right? So they depend completely for their healthcare delivery to the public health. So value proposition communication is happening not to that consumer, it is happening to the decision maker in that healthcare system. So when we go to that healthcare, whatever, health secretary, those kind of people, they are convinced, but it just doesn't get executed at the end of the day. Somebody will get transferred. Sometimes they will say that the budget is not there, and it's not that they're wrong. They in one of the cases, I remember Assam or one of the states, they showed us. They said, see, I have got 100 crore rupees, and these are the things which I have to buy with it. And many of them were such life-saving things that we didn't have the heart to tell them, scratch this out and put my product in. This is not a value proposition problem. It's more of a prioritization problem. It's more of a funding problem, right? Which the public health system has to change. Now we got endorsement for this technology from the central health, the health secretary and Ministry of Health, everybody, they put tweets around this product. This guy's innovation has come on the cover of Times magazine. Can you believe? So that kind of recognition it has got. But the decision is not taken in the central government, it is taken in the state government. And every state, one by one, you have to go. And one by one, by the time their cycle of procurement happens, the guy will get transferred. So those are the practical challenges. That's what I was saying, that the need is there, opportunity is there. How can we create access to them? That's something which we have to think about as a way forward.
Right, so just a follow-up to the question. Just as in US, the insurance coverage is also covers through Medicare and Medicaid. It covers even the below poverty line populations and even outpatient prescription medicines. So in India, in order to get that extent for the insurance coverage for the hospitals and for the patients, what would be the best approach?
Yes, so you're absolutely right, and that's what we know some of the panelists have also been talking about, that insurance penetration is one of the game changers. And I think good steps have been taken in that direction with the Prime Minister insurance scheme which has been launched, and more population covered with that. It's one of the largest coverage of populations. The only problem is that insurance program, ambitious as it is, covers hospitalization only and certain types of procedures in hospitalization. Because the field of healthcare is so huge, this particular technology is not hospitalization technology. It is at-home technology. It is OPD technology, right? OPD, though even private insurances don't cover. That's what we were hearing, right? So that's another challenge of how we can get more insurance access to our population.
Thank you, sir.
Right. So I think we have already encroaching into the other panel side. So maybe we can take one last question. And maybe someone from the back side, I just want to see the students are alive there. Yes.
I think they are shy.
Hello, sir.
So now we have
Good afternoon, sir. This is Sudipta Chatterjee from HCM2. Like in the context of the rise of the startup ecosystem, and currently we are seeing a funding winter which is prevailing currently due to the global economic downturn and all. We have seen that there are 111 unicorns, and in 2023 there was only one unicorn due to this same funding winter. Do you think this would affect the healthcare system as well, as new players won't be able to carry on innovation as they were previously doing? Like in 2022, I guess, there was 42 billion investment to the new startups which promoted to 42 new unicorns. And now we see that due to the global situation that is going on right now, the funding has been reduced, the VC capital funding has reduced. How would that affect the future of startups, healthcare startups?
Okay, so he came up with numbers, and I think what he means is that this space is already saturated, right? And how would you actually go forward? Yeah.
Who will ask me the question to? Anyone? Everyone, it's open.
I think, yeah.
I can try to say this. I don't think there is a funding winter of that kind, right? I think this is cyclical. To a very large extent, it comes back to my mind, I think it comes back to what I said, right? So you have an insane, you have at some point of time, you have people chasing projects and chasing new ideas and stuff like that. They go back, they find that new idea is not sort of delivering to that promise, and so it goes back and they go completely swing the other way around. You've found a lot of this thing happening, and it's not just in healthcare, it's all across, right? So it is a question of sort of saying that, people there is a herd mentality. You have investment chasing projects, the projects not delivering value, and the next time they're getting super conservative, right? So it comes back to what I said. As long as you know what problem you're solving, you have a process of sort of validating, you're creating a robust value proposition, and you sort of actually can demonstrate that value proposition and to your customers, right? I don't think there is a funding winter. I don't think there is. And in any case, I think let's look at it this way. If you're talking about startups versus established companies, right? Startups, in terms of the investment need, is such a small microcosm of it. I don't think it is, it's like it's going to be affected by any global macroeconomic changes. It's a question of what is the value you're creating, how are you able to demonstrate that value. Sorry.
Yeah.
So, just quickly, one more thing I've raised funds within our organization itself. We were discussing, right? The most important thing is that the times when we had tough times, right? The times when we had lesser cash, we were the most efficient, and hence it took the best out of us. जब पैसा ज़्यादा आता है, तो लाइफस्टाइल स्पेंडिंग बढ़ जाती है, right?
Yes,
So I think that for startups or for any organization for that matter, if you have, if you are resource constrained, you will get the best out of you. If you have excess, then fat will get deposited, right? So, I think it should not matter at the end of the day. The best startups will survive despite any startup winter or any funding winter which might come in.
Thank you. Thanks a lot. I know I'm already looking at the time which we are going ahead. So I'm sorry I can't take more questions, but I think it has been a very exciting discussion. We got a lot of perspective about what is happening in this particular space. And as I said, this topic is endless. There are many more questions which could go on. We talked on challenges, unique examples, and what are the problems, what could be done on that count. So with that, I think let's thank our panelists, and over to you for closing.
Thank you panelists for a very thought-provoking discussion. I now invite Professor Praveen to kindly felicitate our panelists.
Okay. Oh, thank you. Let's start it from there. Yeah.
I would request Praveen sir, Arif sir and the panelists to please remain on the stage for a group panel photograph. Now, I would like to invite Professor Shri Rupa ma'am again to introduce us to the final panel of our day.
Good afternoon, and we've reached the final panel now and the last disruptor for the day, and this time the focus is on Ayush. So the theme for the third panel will be Bridging Traditions, Ayush's Holistic Evolution. And this panel has 4 eminent speakers, and the moderator is Professor Ajay Vamadevan. I would request all our panel members to please take their seats on the podium. So as Professor Ajay gets ready with his mic and would start bombarding the panelists with questions, I will take this opportunity to take you through their illustrious profile. I start with Professor Dr. Tanuja Manoj Nisari, the Director, All India Institute of Ayurveda, New Delhi and Goa. Please give Dr. Tanuja a round of applause. Professor Dr. Tanuja Manoj Nisari She is the director, as I said, of All India Institute of Ayurveda. She's also the chairperson of Integrated Accreditation Standards for Ayush, as well as the Ayush Assessor Committee of the NABH. She's also had additional charges of Chief Executive Officer, National Medicinal Plant Board under Ministry of Ayush, as well as the Dean, Faculty of Ayurveda, Unani and Homeopathy Medicines in Delhi University. She was also a chair for Health Sector Subskill Council for Ayush. She has held various top leadership positions and currently holds important positions such as being the member of the task force of WHO, establishment of Global Center for Traditional Medicine at Jamnagar. She's a convener of working group on formulation of integrative health system for Niti Aayog. She's a member of the Board of Governors and Advisory Council of National Commission for Indian System of Medicine. She's on the scientific panel of nutraceuticals, a distinguished expert member and a governing body of the National Innovation Foundation. She has recently been awarded the Ayurveda Ratna. Her area of research are on medicinal plants and mental health, NCDs and exploring methodology for holistic and integrated research in Ayurveda. She has over 30 years of teaching experience and has led over 30 clinical research projects as principal investigator as part of the All India Institute of Ayurveda. And she's also authored over 200 articles in journals. She has authored over 20 books in various languages like English, German, and Marathi. Welcome to you, Professor Tanuja. Our next eminent speaker for the panel is Dr. Durga Prasad Veldindi, who's the Senior General Manager Marketing, Dabur India Limited. Dr. Durga Prasad has over 30 years of rich career in marketing, brand management, technical services, and new business development across the FMCG and healthcare industries. And he has been successful in integrating consumer marketing and prescription marketing to grow healthcare products with healthcare advocacy. He has also been developing marketing plans and has launched a varied range of healthcare products such as digestive, anti-arthritic, anti-inflammatory, immunomodulators, menstrual regulators, and cardioprotectives. Some of his other notable accomplishments include launching 100 new products across various healthcare categories. He's conceptualized more than 35 new product ideas and innovative concepts, and he's the recipient of for his outstanding contribution in the field of Ayurvedic system of medicine by American Biographical Institute. He has also been selected for Doctor of Science by Board of Alternative Medicines, Government of Sri Lanka. Dr. Prasad holds a PGDB in Marketing and Finance, an MD in Ayurvedic Pharmaceuticals, and a graduate in Ayurvedic Medicine. Welcome to you, Dr. Prasad. Our third speaker is Mr. Rajiv Vasudevan, who's the founder and MD of Apollo Ayurveda Hospitals, which is a chain of insurance-approved Ayurveda hospitals and integrative care centers across Bengaluru, Chennai, Delhi, Gurgaon, Kochi, and Almora. Apollo Ayurveda is the first and only QCI DL Shah National Quality Award winner from the Ayurveda sector, the first NABH accredited Ayurveda hospital in India, and with 4 hospitals that are NABH accredited. Apollo Ayurveda has also championed quality systems driven precision Ayurveda medical care for over last 2 decades. It has also effectively demonstrated a pioneering and breakthrough model of integrative care in partnership with leading care hospitals across the country. Mr. Rajiv qualified as an assessor for NABH hospital standards and is the first from the Ayurveda sector, and also has been a member of the first expert committee that drafted the NABH accreditation standards for Ayurveda, the first edition in 2010. He's an alumnus of IIM Kolkata and holds a BTech honors in mechanical engineering from the National Institute of Technology, Calicut. He has also served as country head of PSG India and SARC, Motorola India. He has been a board of directors of the State Bank of India, Kerala, Kerala region for 3 years, been a member of the Board of Governors of NIT Calicut, and he serves on several national committees of Government of India and the CII. Welcome to you, Mr. Vasudevan. I'm very happy and it's a pleasure to introduce Professor Sanjay Kinnara. He's a professor of clinical epidemiology at the London School of Hygiene and Tropical Medicine and the honorary consultant at the UK government's Department of Health and Social Care. His research interests are in understanding the causes and developing affordable solution for management of chronic diseases in India. He co-directs a long-standing cohort study in rural Telangana, which is monitoring the health and lifestyle of 10,000 individuals through state-of-the-art clinical, molecular, and digital technology. It also studies the risk factors and develops affordable molecular and digital diagnostics for conditions such as heart disease, diabetes, dementia, and aging. He has conducted several clinical trials of culturally tailored interventions for self-management of chronic conditions by leveraging advances in behavioral science, which has enabled less skilled workers with digital technology and use of traditional therapies such as yoga and Ayurveda. A big round of applause for Professor Sanjay. And finally, the moderator, Professor Ajay Vamadevan. He holds a doctoral degree from the University of London, where he developed a digital health intervention for managing hypertension and diabetes in primary care. At GIM, he serves as professor and program chair of the HCM program, overseeing academic and administrative activities. He teaches courses on healthcare information systems and advancements in healthcare technologies. As part of a leading international research collaboration, Professor Ajay has secured grant awards from prestigious funding agencies, including the Medical Research Council, National Institutes of Health, USA, Wellcome Trust, UK, and the Indian Council for Medical Research. With over 22 years of experience, he has authored more than 60 peer-reviewed publications, 10 books and chapters, and holds an H-index of 30. His leadership in public health has been recognized through his selection as an Emerging Leader Fellow of the World Heart Federation and a Public Health Leader Fellow of the PHFI Emory University Consortium. A big round of applause for our moderators of the panel. Over to you, Professor.
Am I audible? Yeah. Thank you, Professor Srirupa. Welcome all of you to this panel on Ayush, Bridging Traditions, Ayush Holistic Evolution. So this panel, we have a balanced mix of both academicians and the industry. So my task start with giving you a pace setter for this panel discussion, giving an overview of this context in which we chose this panel. As you are aware, Ayush in India focus on the traditional medicine ranging from Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy. Ayurveda in particular is the science of life and is one of the most ancient and holistic system of medicine dates back to 3000 BC. And from this very evident that the quest for good health and longevity is as old as human existence. So when it comes to Indian philosophy, good health is essential for pursuing materialistic, social as well as spiritual fulfillment. The strengths of Ayurveda are unique. It is widely accepted by the public. It has got comprehensive and holistic definition of health. It goes beyond curative care. It emphasizes the promotion of health and prevention of diseases. Additionally, it emphasizes on diet and lifestyle in maintaining well-being. When it comes to Ayush industry, it includes a wide range of products and services such as herbal medicine, supplements, treatments, and wellness therapies. Backed by the government support, the Ayush is growing exponentially, contributing to healthcare, then tourism, and also catering to the global wellness market. The paradigm shift happened in 2014 when the government took a significant step by promoting traditional Ayurveda by establishing the Ministry of Ayush. This move aimed at revitalizing the profound knowledge embedded in our ancient systems of medicine, ensuring optimal development and widespread propagation of Ayush in our health system. And the public system embraced this change. On the top, many leading hospital chains are now innovating on providing such complementing services at the moment in this country. With the current turnover of around 18 billion market size for the Ayush industry, this industry has been growing at a rate of 17% over the past 7-8 years continuously. And as a result, the Indian firms are growing, gradually moving upstream in the Ayush value chain. Both production and trade of various products are undergoing rapid changes, including export of Ayurvedic products. Ayush is also driving India's exports, boosting medical value tourism, positioning our country as a global leader in traditional medicine. As the awareness of the Ayush medicine benefits continues to grow, it's all set to bring further disruptions in healthcare by offering a wide range of holistic options for wellness, curative medicine and rehabilitation. In this context, we organized this panel with esteemed academicians and industry leaders to discuss and deliberate on this important topic. This panel will conclude by hearing their insights also on how the healthcare management education, particularly in training in India, should adapt to meet the growing needs of the Ayush industry. With this background, we would love to hear your views on, your perspectives on the theme, the role of Ayush holistic evolution. How is it going to shape the future of India's healthcare? Maybe we would start from you, ma'am.
At the outset, I really congratulate GIM for organizing very timely, innovative, and which is most relevant topic for the healthcare management. And thank you for including Ayush also. And maybe the reason what you say is a 1 trillion, what is expected as a growth of the products in 2025, that is estimated with the CAGR of 17. So maybe that is the reason where the healthcare management for the Ayush is the most needed time. Now I take this opportunity to share with the esteemed panelists and with the audience, learned audience, about the Ministry of Ayush, and as like the Ministry of Health has a digital health vertical. We are also part of a digital health vertical, and there is a Ayush grid creating IT backbone, and many initiatives like there is a Ayushman Bharat. Even in the NAM, there are 12,500 Ayush Wellness Centers. So they are all connected through a dashboard. So where the AI and this digital connection and the dashboard is being created. So this is how in a large sector, in a fast pace, we can say amplification is not on 10x but 20 and 25x what we have expected. So it is going at a government level in a very fast pace. Government Ministry of Ayush is very much interested in developing this IT backbone and the AI and all disruptive technology for augmenting and data analytics mainly, and for as we say that the patterns analysis and decision support system and many other conditions. And coming to All India Institute of Ayurveda, which is a tertiary care setup as in Delhi, Goa, and we have many extension centers at IIT Delhi. Then we are closely working with many 74 MOU partners. So we are the first one. As you mentioned, we are the first one, but we are the first one to initiate bioinformatics and IU informatics unit at All India Institute of Ayurveda. And recently we had conducted AI in traditional medicine. That is the global consultation with the consultation of WHO, WIPO, WTO and ITU, where the artificial intelligence for traditional medicine, where we can really have this mapping of the evidence, how we can leverage the evidence-based practices for the society and how we integrate. So these are many things which are already happening.
Okay. Okay. Thank you, ma'am. Over to you, sir.
Thank you, Dr. Ajay, and thank you all the faculty of GIM. In fact, since morning I was listening to the sessions and the disruptive interventions into the Ayush or the holistic system. In fact, it itself is disruptive. Since morning, so many IITians, management graduates speaking so fluently on medicine, speaking so fluently on the medical conditions. So earlier, when I was doing the medicine, doctors used to speak the medicine, engineers used to speak between the engineers and the doctors. But today, all engineers are speaking so fluently about the medicine. And medical doctors speaking to the technology, AI, robotic surgery, etc. So that itself, the disruption is already started. And if it comes to Ayurveda, Ayurveda itself is a disruptive. So the beauty of Ayurveda is, as Professor Ajay said, it's a holistic system. When we say Ayurveda, it's a holistic system. It's not only the medicine. The holistic system, if we see our health, Ayurveda mentions Ahara, Nidra, Brahmacharya, the three pillars of life. If we want to be healthy, we should consider the balanced diet, sleep, proper sleep, and the Brahmacharya. That is a Brahmacharya means not the celibacy, it's a disciplined life. So these three are essential to have a proper health. And if at all there's a medicine, again there, Ahar, Vihar and Aushad. The Aushad is the last part, medicine is the last part. First thing is the balanced diet. So first we need to consider the dietetic principles of the diet, then comes the active lifestyle, then comes the medicine. So if we consider all this, that's the reason why Ayurveda is considered the holistic system. Now, in fact, all the hospitals, you can see there is a clinical nutritionist course they are coming up, clinical dietitians, dietetic counseling. Earlier they were not there. So these fields are proper now growing very sharply and adding to the health of the well-being, health of the individual. So on the health of the individual is a combination of everything. It's not only the medicine. Medicine is a very large part. So the holistic system, when we address, we should take care of all these elements properly. Then of course, there is a quote when says, if the diet is proper, there is no need of medicine. If the diet is not proper, then there is no use of medicine. So either way, the medicine has no use. So please take care of that. Thank you.
Over to you, sir.
I came to Goa with not quite knowing what to expect. You know, I got this invitation from Professor Ajay Vamdevan, and then it looked like something very interesting when we spoke over the phone, and then it looked like he had some vision. And then later on, when the panel was put together, it was quite clear that there was a lot of thought which had gone behind it. So before I begin responding to Professor Ajay's question, let me compliment all of you students for being in a very, very good institution, because I think both from the way that this day has been put together, the thought into the three panels, the fine panel of speakers, and also the questions I heard coming from the audience, you know, HCM 1s and 2s, I could hear some of them, shows that there is a very good pool of talent coming up here. And I also heard yesterday that the way your program is constructed is distinct and different from much of the MPH programs and the MHA programs. So I think you're fortunate to be here and glad to be here at GIM. So with that, going to this point of bridging tradition or tradition bridging through disruption, I want to take that word disruption and use the word inclusion, right? Because disruption is fashionable, right? I don't know how many of you have heard Clayton Christensen, professor at Harvard, Harvard Business School. So he first came up with the term disruptive innovation about 24 years back. It's been a favorite term. Everybody uses disruption. Why should I break down something? Is there a way to not break down? Can I merge? Can I meld? Can I mold? So when you look at that, and incidentally, if you go back to the talk, you'll find that he talks about the problems of the American healthcare system, right? And the solutions that he proposes in that, he goes into, there are three parts: the healer, then the chop shops, and then he talks about precision medicine. And today we are so enamored with technology and these words, again we may miss the fact that if you listen to Clayton Christensen, and if you really get into detail, what I would posit, we don't have the full time, but to the extent we can, to say that possibly Ayurveda is the answer to what Clayton Christensen and the world's health systems are seeking. Why do I say that? Right? Why do I say that? Because when you look at healthcare, again, this is an animal which means different things to different people, right? You're all healthcare management students. What does healthcare mean, right? So you'll get some standard boilerplate definitions, right? But go into, somebody will say what are the types of healthcare? You'll say primary, secondary, tertiary, quaternary healthcare, right? These are terms which have just gone ahead and we just parrot it. Look at it from a consumer's angle or a patient's angle or a individual's angle. If you look at his life cycle health, where does it begin? It begins from the womb, or it begins preconception, right? So if you look at preconception and you look at primal prevention, right? When you say preventive care, there's a unidimensional view, what we think, and I'll tell you what is that unidimensional view. Primal prevention is what I do to help the health of a mother, expectant mother, so that the child yet to be born has maximum life potential, right? That's where healthcare begins. Today, we produce generations of under-potential Indians and under-potential world citizens because we don't focus on the whole process of childbirth, right? It's not after child mortality, maternal mortality. All these indicators are so flawed, they suit some economist, some funding agency. It is not really tackling the cause. So you go look at primal prevention. Then you come to primary prevention. What is primary prevention? Two parts. Access to clean water, clean air, no mosquito bites and stuff like that. On the other hand, appropriate diet and lifestyle. Things within my control, which can ensure that I don't succumb, I don't develop a disease. The most common thing that we know about preventive health is the annual medical checkup, which young people, I would tell you, is a good thing to do, right? Most people take it, put it into the drawer and forget it till the next year, right? What does it inform us? So let's keep primary prevention, we'll come back to that. When both primal and primary don't work, you come to secondary prevention. How many of you are aware of this continuum of primal, primary, secondary? Can you put up your hands? Okay, good to know, great. So it's a term which is normally not spoken of. I've been talking about this now 18 years and repeatedly mentioning this. Secondary prevention is nipping in the bud, early stage serious disease, arthritis, hypertension, diabetes, thyroidism, etc. Right? Take any disease, can you nip it in the bud before it becomes a full-blown disease? Right? Give you an example. Take pre-diabetes. It's a classical example where I've started seeing the diabetes. Right? My sugar level has gone from 90 to 100 mg per dl. Right? Sorry, 100 to 125 mg per dl. Right? As I see myself, this going up from 90, 92, 95, I know it's going up. The number of pre-diabetics in India is more than the number of diabetics in India. Of the diabetics, the number of latent diabetics are huge, right? And guess what? 7 to 8 years before I'm diagnosed as being diabetic, my insulin resistance has already peaked. What am I coming to? Any type of intervention during this particular process, you go and test, etc., you're not going to pick up that this person is progressing towards pre-diabetes and then eventually to diabetes, right? Now, what would be an ideal thing? This pre-diabetes should be reversed and the person should be made non-diabetic. But the data globally, right, in the US, I heard some major insurance player tell me 96 out of 100 people who are pre-diabetic become diabetic, in spite of incentives. So there is something fundamentally not working in the way we are approaching healthcare, right? We get so enamored with technology, cutting, robotics, this thing, that thing, we forget the bulk of the people. And this is where secondary prevention, when that doesn't work, I go to acute emergency care. Once acute emergency care is over, you come to a phase called tertiary prevention. Very important. Why I want you to understand, if you're looking at startups, you're looking at innovation, you need to look at these stages of care. So quaternary prevention, tertiary prevention is rehabilitating, preventing recurrence of the disease, and restoring positive health. Right? Huge opportunity. In the US, more money is spent on the tertiary prevention than the actual active phase of care. Right? Now, Ayurveda has got solutions at primal, primary, secondary prevention, and even acute on chronic, but probably not in most emergency care situations. And it also does in tertiary prevention. Why I'm bringing this up? In India today, only 1/3 of healthcare demand lies in that emergency care. Everything else is before and after. And Ayurveda is very well placed to tackle this 2/3 which lies outside where the major investment and the entire discourse narrative is going on, right? So what is this holistic care when we talk about? We need to understand accessibility, affordability, all these words that are there, right? We need to understand appropriate care, and I am just coining a new word, because if you look at tiering healthcare, primary care, now let's go to primary, secondary, tertiary. If I go to the HWCs that Dr. Tanuja spoke about, or the wellness centers, Arogya Mandirs, which have been created, how do we ensure that at that particular level, you can bring in, today we don't have enough doctors to go to rural areas, but is it possible, using an Ayurveda concept, to ensure that at that village level, we are able to effectively manage the health of the community? And I'll just conclude with this. I know it's a long thing, but I'll just conclude. If an Ayurveda doctor essentially is able to triage, because some of you will be looking at public health, so I just want to leave this thought with you. If a practitioner, whoever he is, in the HWC is able to triage the patient in terms of in terms of the severity level of the condition, overall health status, and if required, escalate it to another center, but otherwise manage the thing at a symptom management. And one key thing I want to tell you, Ayurveda achieves two things. Number one, it can achieve symptom alleviation. Number two, it can do disease reversal. So just go and look up a term called disease management and figure out how much of, other than in Ayurveda, who does disease management, that term what comes, which means basically you're treating the root cause of the disease. You'll be quite surprised to note Ayurveda is one of the few systems which will treat the root cause. And so when you talk about the word Roga Nivritti or Roga Nivaran, Ayurveda can do that. Roga Shaman, which is basically alleviating. Both these things are achieved. What you think is happening in a thyroid management or a diabetes management or asthma management, check any disease, you'll find it is only symptom alleviation that you are currently thinking of. So I want to challenge your long-held stereotypes about what is healthcare, right? And the role that innovation can do, why India should not follow the journey that other developed countries have done. But let me remind, 20 years back, the health secretary of the US government visited India. He was George Bush's secretary. George Bush was just going out, Barack Obama was coming in. He was interviewed in the Hindu, op-ed at full page. And the question, it just put to the headline, Mr. Secretary, what brings you to India? And he says, I come to India, we're running out of ideas in the US. I would like to learn from the traditional systems of medicine of India, right? Now, why I'm bringing this up, others recognize. We too should realize that sooner than later, Ayurveda is going to become what we call the Brahmastra, right? And I'll conclude with this point. How does it achieve that? It does primal, primary, secondary, tertiary prevention. And finally, there is a very powerful area called therapeutic wellness. So Ayurveda has got disease management, Roga Nivaran, Roga Shamana, and also Swasthya Rakshana or Swasthya Paripalana, taking a healthy person and making him healthier. So this very wide vision of what Ayurveda can do from a public health system perspective, there cannot be anything richer. Guess what? When we come today and we say the WHO, SDG 3 goals, right? Health for everybody at every day and all these things. Ayurveda, the way it is perceived, community health, all of these at once, and we feel pulled from Ayurveda. Even the contemporary definition of a healthy person in WHO, circa 1976, is preceded in 600 BC with a sloka which is far richer, far more precise. So I would urge at this point, holistic health again is let me clarify, is physical, mental, spiritual health. Okay, those perspectives. But there is more to healthcare, and Ayurveda is an extremely enriching area. Dr. Durga Prasad reminded us there are more engineers in medicine and doctors coming to technology. Let me tell you, anybody coming to Ayurveda, any rational, intelligent person, it is very different from this Nadi Parikshas and the kind of mystical period which is there. It's an extremely mature knowledge system, the highest level of systems thinking that you can apply to the health of any system. So I encourage all the students here to explore careers, opportunities, entrepreneurship, tech application in the field of Ayurveda. Thank you for your patience.
Over to you, Dr. Kinda.
I don't have very sort of deep thoughts to share on this, but I'll give just a few remarks. Firstly, like Rajiv, I think I'd like to really show my appreciation for this institution and the students here. So I don't work in management. I was not familiar with your institution. But since I've come since yesterday, I've been extremely impressed with the people I've met so far, the state of the organization, the agenda for this program, and for having us. So thank you so much for all. So I'm a scientist by default. So I think I'll just, maybe if I can start my remark with a question. Who said this? In God we trust, but everyone else must bring data. Possibly. I actually, both sides must be right.
I thought we all use that during my years in Hewlett Packard. I thought it all belongs to us. We never explored who is it. But we continuously use this.
Yeah, so I think.
I'm curious.
Yeah, no, I'll have to check up, or maybe somebody in the back can check up while I finish my remark. But I think, for me, I think I agree with what our panelists have said, that there's populations are aging, including in India. There's going to be a huge amount of even newer health challenges to solve. So I mean, we talked about earlier there were mother and child health problems which are still there in India, infections. Now we started to talk about non-communicable diseases, obesity, diabetes. But in the next few decades, the Indian population will get older, and then the problems of aging will creep in. So we started to see a lot more of dementia, cancers, and other issues, as well as other kinds of problems that we face with the aging population. So there's going to be lots of health challenges for you all to solve, because it'll be just the right time for you. And we also know that Western allopathic medicine hasn't been able to solve a lot of them. In fact, talking about data, people assume that Western medicine, of which I'm a practitioner, is just based on evidence base. But it's only about, there was one review citing only about 5% of Western allopathic medicine had scientific basis on it. The rest is a little bit made up by all kinds of experts. So I think in that respect, I think one of the challenges that the world of Ayurveda, even though it's been so old and well recognized within our country, has been the lack of data to bring to the table. Especially in the world where we live in, where we have to justify the effective and the cost of everything we do, and against competing priorities. So then the solution becomes trying to look at the data available to support financial and other decisions. So I think in my mind, if there's a big innovation that could happen, I mean, definitely I'd fully agree that the solution will always end up being an integration of the Western and the Eastern system of medicine, especially with the way the world is evolving. But the huge innovation for me would be trying to bring data to the table from the world of Ayurveda to support a lot of what is thought to be known, but it'll be good to have data to support it. And that, to me, that's where all of the other kinds of disruption, like even AI, could support, because you can use it to provide service and still generate data on some of the issues. So that, to me, would be my interest in terms of the innovation happening in Ayurveda and integrated. Thank you.
Thank you.
With permission of Professor Ajay, to make this last panel a bit lively, I found, but we should have some reward. This is Edward Deming, the famous. Sorry, madam. It's you know Deming, right? I mean, we all have used Deming's statistical quality. There is Deming's award, so it's Edward Deming.
I wish I had a chocolate too.
At least we can have a big round of applause.
No, this is also to show off to the students that at the end of the day, we are still young and alive.
And you know how to use the internet.
You were telling something.
Yeah.
Right? Did you complete what you were
Yes.
saying?
No, Deming, no, it's an important point. In case you are not aware, I'll throw my voice. Deming, how many of you, anyone knows who was Deming? You know? Yeah. I mean, he is very renowned. But Professor Sanjay ji, jo bola, all these things should be to make you think. So I wondered, all this time we had been using Phillips, HP, this sentence, but never thought it was someone else's. It had to be his, perhaps, So Deming, you can explain to the students later why this can come only from him, It is integrity of data it is integrity actually. Yeah. Of data.
Yeah, coming back to the panels.
So we have the one panelist in the audience.
Yeah. So taking a leaf from what you suggested, over to you, ma'am. The question is about, from your experience, you have worked in the state health system and then moved to the central education institute. So the ongoing integration of the Ayurveda, Ayush systems and the modern medicine, how do you see the true spirit do we see in that integration when it comes to practice?
Yes, it's a very the relevant question. Before I just complete, I just would like to say that the Ayurveda, it is considered that it is an art of healthy and happy life. It is a way of living healthy and happy life. But what I have understood as a 30 years of experience as an academician, as a researcher, Ayurveda is the most well organized, systematically organized, data-driven science. Since starting from the Veda to the classical text, because choosing who is the best disciple, Shishya Pariksha, Acharya Pariksha, it is said that one of the qualities of the student is he should have the Sankhya Gyanam. And the commentator says that Sankhya Syat Ganitam. So he should have that time it is a biostatistician, or now we say that it is. So Ayurveda also is a database science. We have a practice-based evidence. So the practice-based data, what we say that now it is a HMIS, Hospital Information Management System. But now we have now the entire world is looking at evidence-based data. So this is the one thing, and whatever the narratives, if you go to the classical text, Charak Samhita, the doshas are 3, the disease classification is 3, 8, 7, 12, there are 7 types of Prakriti, there are 24 types of subtypes, so everything is narrated in terms of the Sankhya Ganit. So Ayurveda also the one who is a good mathematician, who is who is a biostatistician, he will understand Ayurveda more better way. But what is the beauty is, when we say that the art, it is because this mathematics and the applications are more individual specific. Though this is a designer customized medicine. So when the Vata person, then we have to design the protocol and customize it. So for that, this AI and the disruptive technology would be very useful, because when we say that the one example I just give from the classical test, it says that yah syad rasa vikalpatnya sa syad dosha vikalpachit. And the one who has understand, the scientist, the Vaidya, physician who understand 63 types of permutations and combinations from the disease, the one person, and the disease is manifested in 63 types in one person. Dosha, permutations and combinations. Like there are only 3 doshas, Vata, Pitta, Kapha, but the disease is manifested Vata, Kapha, Vata, Pitta, Kapha, Pitta, and all this now you can understand as a scientist how many permutations, but very precisely 63 types of permutations and combinations. Age-old back our scientist has given. Then the solution are exactly 63 types. So if you have to, the one who is the best physician, If he understands Vata Pitta person in madam, and then identifies picks up the correct opposite plant, then he fixes the problem, the lock and key mechanism. So now that point we say that it is my wisdom, Guru Shishya Para, from Gurukul, now Guru Shishya, from Guru Shishya we have moved to Kula Guru system. So now to make it what you said, Sanjay Kindraji, about this data needs to be brought on the table. So this AI can do this. So these 63 types blocks and with the 60 types of keys in forms of the drug. So maybe we can match that. So that disruptive technology can do this. So we have the problems and the solution in terms of, and that would be very easy to understand. We can put on the plot on the one, and then we can really have that network pharmacology and the predictive science. So this is what we are doing as in the drug development, and that's what we say that the lead can be developed. Even in predicting what we are doing as a diabetic, the one who is getting all this metformin for the management of the diabetes. But for us, we say that the person having the Vata predominant may not get the complications as a nephropathy, retinopathy, or who will get and who will not get. So I think this is how we really have to work together. And at All India Institute of Ayurveda, where we have 2.7 million patients and 2,000 patients visiting at Delhi and 700 patients visiting at Goa. So almost 3,000 patients and visiting Delhi. And within this data, these patients with HMIs, what we understand for us, it's more interesting, is to have the integration, your question, I'm coming to your question, what is the role of integration? So the earlier integration was like traditional medicine with conventional medicine. So what we say that to make it classical yet contemporary for all our healthcare managers for the future, if we really want to make it contemporary, so we really have to have this tradition supported with the technology. So then it will become the most contemporary and we can deliver it on the table of each and everyone. And coming to my friend Rajiv Vasudevanji, same when he said that the primary care is very important. So if we really have this integration of technology with the tradition, then I say that, and I mean to say it, that the future of the medicine is no medicine, because then the medicine will not require. We know that which diet is good, which lifestyle is good, we can fix the problem, and then the solution is already there. Medicine is in integration. Why I say that? If medicine is in integration, why I say that? If someone conventional medicine is giving allopathy medicine, then the Ayurveda can bridge the gap, like identifying, bridging the gap with the diet, lifestyle, and Panchakarma, Shodhana, and then you do. We are working with NCI Jajjar, which is a super specialty hospital for the cancer management. So for any cancer management, primary and secondary prevention, chemotherapy, surgery, what we do Panchakarma, biopurification, and prepare that person for accepting the radiotherapy, chemotherapy more precisely. Or after surgery, we do the Ayurveda management. So this integration really helps in a better outcome. We can capture it with the data. Thank you.
Okay. So next question is to both of you, how the Ayurveda research institutions and industry collaborate or advance the Ayurvedic innovations, practices, taking those innovations to market.
Yes, this what you said, it is in your brochure also, PPP mode. And PPP, that is a like a public-private partnership, but industry-academia partnership really helps, because industry has to deliver as per the market need. And if the academicians and the researchers, they join, then whatever is the best possible, because the academician have to be authentic. They cannot really serve the industry for their need. But if that industry academia partnership with the government can really help, and I'm really happy to share that. The Dabur is the one, and thank you to Dabur India, that with their 3 ASR funds, they are supporting All India Institute of Ayurveda 1 CR per annum, and with that we are supporting our postgraduate scholars, minimum 10 lakhs, 15 lakhs to take the best possible dissertations, and that support. So this is how this industry academia partnerships is very, very important. And industry is not only the pharma industry, maybe the IT, because when we are developing this disruptive technology, then these startups and this AI and these technologies, they should come with the startups, and we are helping them. The ministry, government is helping with this startup, 15 lakhs for the startup innovative ideas, hand-holding them. And for the Ayush, they give the awareness and upgradation. So this is how the integration with the tech industry is also required.
Also, sir, from double point of view, we are associated with almost 74 institutes. We have MOUs with 74 institutes in India and abroad, where various research methodologies and the treatment modality also, it's not only the finished product, and the treatment modalities and some basic concepts of Ayurveda, revalidating. Of course, as a Ayurvedic doctor, I don't entertain the word of research in Ayurveda. There is no research in Ayurveda which is required. It already researched and published in Ayurvedic textbooks. What we are doing is actually revalidating the same concepts. So we are doing much work with many universities like Amir Shah, the Jodhpur University. So there are 74 institutes which we are working. Work is in progress, and particularly what we are doing is we are working seriously on the lifestyle problems where Ayurveda can score much higher the probability, because if you see the healthcare system, every system has its merits and demerits. While allopathy or the conventional system is very good in acute treatment and emergency care, where Ayurveda might not have so much advantage, but at the same time, Ayurveda, the lifestyle, has a very good advantage in the chronic or NCDs. So if we can supplement, as Madam said, in the emergency, go for the allopathy, get that, and Dr. Vasudevan also said now, that 1/3 of the patient, you go for the allopathy, and either ways, you go for the traditional treatments, then we can reduce the cost of the treatment, and we can give a better health for the quality of the life for the patient. So that's what actually we are working on.
Okay. Can I respond to?
Yeah, please.
So to your earlier question about how the trends with working with modern medicine partners, I think there is definitely a movement towards greater acceptance and openness. While there are one group of people who are not, who resist the changes happening, but overall what's happening is that young, educated, internet savvy, people with purchasing power, all these people are coming towards natural, organic, wholesome systems of health, right? You'll see that's why health foods are proliferating. And so the demand is coming from the bottom, number one. Number two, the young are seeing their parents and their grandparents, how they struggle with health, right? So it's quite apparent. Something is not working completely. They know when to go where, number one. Number two, the support of the payer system, right? This point came up in the earlier panel as well. You see that insurance over the last many couple of decades, there has been increasing patronage for Ayurveda. But over the last few years, and particularly in the last 6 months, I would say, there has been a great movement towards affirmative action from IRDA, whereby all policies sold from April 1st have to compulsorily include Ayush without any limitations. So that's opening up. The moment these things happen, what we think one system has grown and not grown is also a result of the way the government and the system has patronized one versus the other. If you look at pre-insurance growth, even for private allopathy hospitals, you'll find that it was one rate of growth, and Anjanda can probably corroborate that or refute that. That the growth, how the private chains grew with insurance. Similarly, CGHS. Today you have NIMHANS, ISRO, DAE. All the companies are asking. Next week we have a private company in Bombay asking for 1,500 employees wanting Ayurveda to be done in their in the community. So clearly there's a move. So it will payer support and this thing. But what is integrative care? We need to understand. It is not one doctor doing two things. It is not this mixopathy. I would like to term it as co-managed care so that we understand what this means. A different rogi roga avastha, different stages of the patient's health and the disease. You may choose one or the other system, okay? So take, for example, what we do in real life, and you can see reports with videos on our YouTube channel. Road traffic accident, quadriparesis, initially neurosurgery comes in, does the surgery, saves the patient, he's in ICU, and is really in a very bad state. We come to do very, very small supportive treatments, oral hygiene, to relieve constipation, pain. We do a few things, help sleep, feet massage, etc. The person gets better sleep. The next phase, when the patient stabilizes, PMR and Ayurveda are coming in, physical and medical rehab. In third phase, patient transferred to Ayurveda, all happening seamlessly. And this actually is something, as was told even earlier in the earlier panels, in the morning panel, you need technology. Why are we waiting? Why could those biosensors not be used? It could have saved so many lives. Why could we not have used the kangaroo machine? All these things are opportunities. Similarly, appropriately integrating Ayurveda with modern medicine. Enough studies, as we speak, we have a glioma study. There are certain cancer gliomas. Chemotherapy-induced peripheral neuropathy. In nephropathies, where people are waiting for kidney transplants, we can reduce the frequency of dialysis. Many, many, many use cases. India can innovate, and I think there are enough clinicians on modern side who are willing to collaborate and take this forward.
So digging deep on that point on insurance, typically these insurance companies, they only entertain hospitalization with a minimum number of hours and primarily for curative care. But when it comes to Ayurveda, it's not just curative care, it's holistic with far more focus on prevention, rehabilitation. So do they entertain the entire spectrum, or how is it?
So I think in that question there is a little fallacy.
Right.
Okay. Insurance companies only pay for hospitalization, period. Right? Where there is a problem to be corrected. They're not into wellness per se. Wellness comes under a different component, which is basically to engender policyholder loyalty. It is not really part of the fact that I've got a particular percentage kept so that my customers remain loyal to me. So wellness today, and the OPD part that you spoke about, let me say there are a few private insurance companies which have opened up OPD coverage now. So that will happen. One of the key issues and where technology can play a role is to ensure authenticity of the interaction so that you don't have false claims coming, and to ensure that you have the person. So with a GPS place locator, you'll be able to ensure the patient is with the doctor is there. All of these things will happen sooner. But issue today is not really that. Issue is a paradigm where, and I think we need to understand from a health economics angle something very important. The length of stay in a modern medicine interaction is about 3 days, 4 days, right? They try to minimize it. The cost is very high. On the other hand, in Ayurveda, you can achieve a much, much longer length of stay. And this is very important to understand. Where is the business model which enables a patient to get, a stroke patient for rehabilitation cannot go home in 4 days. What do I do after that? So what Ayurveda does, lean capital, high quality. So this thing about the insurance coming in, etc., what we need to understand the value that is being provided. Ayurveda gives extremely powerful complementary and supplementary value to the patient. And that is why in rehabilitation, as we talked about, even in serious issues, when if there is a phrase called acute on chronic or acute condition. So I have a chronic condition which flares up, I come. And please understand, most patients come to us as a treatment of last resort and then get benefit. And so therefore there is a groundswell of opinion people are creating. As supply increases, demand keeps increasing. And it's not, so one of the reasons that Ayurveda has not grown to that extent is because supply of quality healthcare is not sufficient. And with NABH coming in, other quality accreditation standards coming in, including for integrative care centers, today you have a situation where quality accredited healthcare inpatient hospitals are increasing tremendously. So the battle is not between insurance and Ayurveda, etc. These are progressive steps that are happening for mainstreaming of Ayurveda is what I would say.
Okay, one follow-up question to you again. Can you elaborate on how, why Apollo was interested in investing in Ayurveda? and how is it different from the traditional hospitals?
Yeah, to be specific, when you look at Apollo Hospitals, which is probably Asia's biggest integrated health enterprise, right, with over 12,000 beds, 6,000 pharmacies, and everything that is in healthcare. The vision that we really brought in is something similar from an Ayurveda perspective, which completely complements. So, if you look at the continuum of care, I talked about primal, primary, secondary, tertiary prevention. All of this sits perfectly well within the Apollo ecosystem. Of course, what was very challenging was to establish credibility and trust. So, as Ms. Amira was speaking the previous panel, it takes time to build that credibility of what your protocols are, what your data is, and what we could see, a mutual synergy, which is playing out as we speak, right? And the good thing I want to say, and this is actually lending testimony to my previous point, that our partners, whether they be Medanta, or whether they be Astamed City, or whether Sri Shankara Cancer Care, or Divakar's Hospital, which is for maternity, all of them continue to be partners even after Apollo has invested in us, because they know very clearly that these are ways in which we can grow together to serve the patient. And this is really a good win-win for the healthcare sector, and we continue to grow.
So how is it different from the traditional?
So if you were to look at it, end-to-end protocols, we are, as was mentioned in the introduction, in 2010, we got the QCI DL Shah National Quality Award. We compete with modern hospitals to get the award, right? So they come and see 5 NABH accredited hospitals. All the hospitals are NABH protocols aligned. As we speak today, one of the new hospitals getting NABH accredited. We are QAI accredited, which is for transition care, Quality Accreditation Institute for step-down care, integrative step-down care, the first hospital. We were selected by Harvard Business School, Harvard School of Public Health for the entire public health program, where they select 3 companies globally which can have an impact on public health. The reason I'm bringing up, the world is looking for a system like Ayurveda and to come forth. And this whole discussion on data, I would like to tell you about AI and this thing. My contention, Anjanda, is that Ayurveda has refined health knowledge. Whatever you're seeking through now X-ray, this thing to come with data, what we have today is the distilled knowledge of millennia, not generations. From the beginning of time, all the observations, it's been weaned off, filtered out, and that essence, which is why Dr. Durga Prasad says, if at all we have to revalidate, and this is important, go and look up the need for n=1 trials. There's a paper in Nature 2015. And precision medicine or imprecision medicine. Why I bring this up, Dr. Sanjay was frank enough to tell only 5% of what we claim to be modern medicine is evidence-based medicine. What does this paper actually tell you? Out of the top 10 selling drugs in the US, just look it up. Top 10 selling drugs, for every 1% it helps, 3 to 24 people do not get helped, right? So what clinical trial worth billions of dollars has established the validity of that? 3 to 24 don't get, which means it's actually totally imprecision medicine. So the beauty of Ayurveda, and I want to place it here, is there a possibility for a personalized system of medicine at scale? And Ayurveda gives you mass personalization as a possibility that will be enabled with technology. Further, it can speed up. So that's the future of healthcare. And further, Ayurveda goes beyond disease reversal to life cycle health management to lead to sustained well-being. How many of us talk about the fact that somebody had a surgery and he's now changa, he's completely healthy? We only talk he's alive, he's walking about, right? Our health expectations are so low that this is enough. Ayurveda takes it beyond and gives you promotive health, convalescent care, geriatric care we talked about. Take something like pediatric developmental disorders, right? Spate, epidemic of pediatric development. Ayurveda will be able to help. Take insomnia. There is a recent article, globally a pandemic. Ayurveda will tell you why is there a pandemic of insomnia, how it can correct. But Ayurveda has got work to do. And I encourage all of you to be part of the Ayurveda journey.
Yes. Over to you. Coming to Dabur's pharma business, can you elaborate on how you innovate on new products, how the business is going on, and Are there
scenario. As you mentioned in your commentary, as on today, of course, there are various sources to give the data, but as on today, it's believed that Ayurveda is about 18,000 crores market, as on today, which is growing at almost 17%. I'm not talking Ayush, specifically Ayurveda products only, not taking of services alone. So Ayurveda products is at 17,000 crores market, which is growing at 17%, which looks very healthy, which is very good. But if you see, out of this 17,000 crores, how many companies are having turnover more than 400 crores, 500 crores? Hardly 10. Out of 17,000, more than 500 crores is hardly 10 companies are doing. And within the 1 to 10 crores, there are more than 5,000 companies, between 1 to 10 crores. And ma'am knows, if you go through the UP border and along the Ghaziabad, every gully mein there is a Ayurvedic company. So there are regulations, but the implementation is not so good. And in the marketplace, everyone is selling the same Triphala or the same Ashwagandha. So if we want to compete with them, it will be very difficult. So what is the difference between the Dabur Ashwagandha or somebody's other Ashwagandha, which is available at a much lower price? But as Dr. Vasudevan Raju said and earlier panelists also said, for the healthcare, so healthcare and consumer care are totally different. In the consumer care, what we say is consumer is the king. What we say, consumer is the king, consumer is the king. But in the healthcare, don't think of consumer. Doctor is the king. We need to get the trust and the credibility of the doctor. If I give a medicine at the lowest cost, and if it is not giving the desirable result, how matter the big company is, it has no value in the mind of Dabur, in the mind of doctor. So there I have to establish a quality into the Dabur's prescription. So to do that, what we are doing at Dabur is, now we are taking the advantage of the technology. We are taking the technology at various levels. Because again, if we take the example of Ashwagandha only, there are almost 24 to 28 varieties of Ashwagandha available in the market. So if someone goes to the market and get the Ashwagandha, there are 24 varieties. So which Ashwagandha is good, which Ashwagandha is not good, by organoleptic properties, it will be very difficult to say. So there is a Ashwagandha, we need to identify the biomarker, whether the vithanolides or cytoindicides, how much percentage is this. If the vithanolides and cytoindicides are 5%, then only that Ashwagandha is useful as a anti-inflammatory or analgesic or Vatahara, Kaphahara, whatever the properties mentioned in Ayurveda. So that biomarker compound has to be analyzed by the various technologies. I'm not going with the technologies. So that we do. Then after that, there is a process. The standardization doesn't mean only at the product level. Raw material standards, the procuring of the raw material and the processing. How are we processing? After the processing of the finished product, once the finished product is done, whether the product is stable or not. I'll tell you an example, churnas. Everyone knows churnas, Triphala Churna, Ashwagandha. Churna is just a herbal material, herbal powder. You don't use any preservative in that. So the moment churna is open in the container, HDPE container, the shelf life of the churna is only 2 months. Within 2 months, the churna will lose its shelf life because it's the only organic material. But usually, unlike the practice in the market is people will consume it more than 6 months, 7 months also. So how do we ensure? And if the churna is not properly processed, the herbal powder is not properly processed, within 3 hours, it gets the bacterial infection, E. coli infection, within 3 hours. So after various discussions with the government, Ministry of Ayush and everything, now there is a process established that the raw material before the processing, after the processing and the churna, the 3 stages, it has to go through the gamma radiation process to minimize any bacterial growth. Then you pack it, and if it is sealed, then it can be used. If it is unsealed, then within 2 months it has to consume. Now, there are many small scale companies who might not be doing all this process, where the product will be available at a much lower cost. But whoever the company is adopting these processes, there the cost of the process, cost of the raw material will go up. So these are the things which we are doing at Dabur, from the raw material sourcing to the finished product. And for certain products, we need to go for the safety studies and the clinical scientific studies for the efficacy studies, whether the product is effective or not. So all these things which we are doing at Dabur to get into the Dabur's doctor's cabin, to get into the prescription behavior, to change that he or she writes the Dabur's product with conviction. Because see, at the one end, Dabur has a history of 140 years legacy. With simple one product, we can't destroy the legacy of 140 years. There is some trust which is built over the years. So the trust has to be enriched, that has to be built further. So that's how we are working to provide as much as possible the quality products, whether it's ashwagandha or brahmi. Here I'll tell you one thing. The vithanolides or cytoindicides are only the biomarker. It's not the active compound alone. When we see the innovation, earlier one company, way back in 90s, one company, what they did is, they have isolated bacosides from Brahmi. Considering that in the Brahmi plant, bacoside is the only active material to improve the memory or to improve the concentration. So they have identified isolated the bacosides, put these bacosides into the capsule form and launched a product for that to improve the concentration. But unfortunately, that is against the principles of Ayurveda. Ayurveda believes the drug acts on a whole. Ashwagandha or Brahmi, it acts as a whole. It's not the only one alkaloid which is acting. In a plant, there are pectins, there are tannins, there are alkaloids, various other molecules which are acting. The product which was launched by endorsement from Vishwanathan Anandji, the product was bombed in the market because bacoside alone will not work. So innovation doesn't mean that मैंने एक capsule launch कर लिया, मैंने एक alkaloid launch कर लिया, इसको तो innovation has to be productive. So that's the area where we need to work, and we are working. Now coming to the challenges, the last point, challenges. Now one new doctor has emerged in the market, the Google doctor. Actually, I am not the right person to say for the allopathic market, but for Ayurveda, Google doctor is actually demeaning or destroying the Ayurveda market. The reason why I will say, in Ayurveda, the drugs are mentioned as per the dosha basis. Vata, Pitta or Kapha, there are the body types are the functional energy. Vata is the kinetic energy, Pitta is the metabolic energy, or Kapha is the potential energy. And the drugs are mentioned like ashwagandha is for Vata Kapha. So as a doctor, I can prescribe ashwagandha for any Vata Kapha condition. But in the Google it says ashwagandha as a sexual wellness or the anxiety, stress. So if a doctor writes ashwagandha for some product, for some condition, he will go to the Google and say, "Arey, you gave me a wrong product. This is I am not having stress. I am not having anxiety. But this is not for anxiety. I gave him some other therapeutic indication." So this Google doctor is actually hampering the business, the Ayurvedic classical Ayurvedic business. That's one challenge which is having. The second challenge is of course raw material availability.
Right.
Because of the excessive commercialization and deforestation, quality raw material availability is gradually coming down. So again, to answer this, we are having a cultivation on our own. In 15 cities, we are cultivating almost 74 species. In 12,750 acres land, we are cultivating on our plants and using in our medicines. So that's how we are facing the competition.
Okay. Thank you, sir. Over to you, Professor Kindra. So you have done the largest yoga-based cardiac rehabilitation trial and also ashwagandha trial in long COVID. But you have a background of allopathy with pediatrics training. So what led you into this unconventional space?
Lack of focus. I think it's probably the fact that I think this is as people have said, it's a very old traditional science. And then along in history came along Western medicine and started to dominate. And then all the systems for testing whether something is a good or a bad idea became determined by using the Western science standards. And that's a challenge, because going back to another saying, there's another scientist called Godel who said you should never try to judge a system from rules within the system. You have to look from the outside. And so I think one of the challenges that I could see from my perspective that the world with Ayurveda was facing was they were sort of stuck in the middle, that their system isn't enough to convince the world at large. And so I thought with my skills in Western science, I could potentially help them generate evidence on their science, but in a language that would be understandable to the other side, and come to some kind of an agreement there. And my thinking there was that it has to be done as Rajiv was saying, that it has to be done carefully. Like talking about integration, integration shouldn't mean a little bit of this or a little bit of that. So you have to do this carefully, and also if a system of Ayurveda prescribes a holistic solution, it's slightly a bit difficult if you just pick one little bit of the whole solution and try to evaluate it. So my thinking was that I could help them to be creative in terms of assessing the whole system. So creating mechanisms where you're evaluating Ayurveda in a kind of a menu-based approach, that there is a system around it that's being tested, but within that there is a flexibility that Ayurveda calls for. So it doesn't mean that you have to treat every patient the same way. But if you always say as Ayurveda practitioners that we are going to treat every patient in our own way, then it'll never be acceptable to the other side. To me, the solution is like you go to a hotel, you give one menu, you can pick anything in the menu. So you're comparing the benefits of one menu against the other menu. Within the menu, there's flexibility for you to choose what you like. That was my way of thinking, that maybe that approach might be one way of bringing the two sides together into a more integrated model. So with that vision, I've tried to do these number of studies. They've all had the same model. We've tried to integrate a protocol-based approach for a Western. But for example, let me give you, maybe it's easier to articulate with the yoga trial, for example. So in the yoga trial, we tried to come up with a yoga-based solution for cardiac rehabilitation for people who have a heart attack. After heart attack, their whole physical and mental state is down and they need to be rehabilitated, with a program of exercise and advice on diet and stress and all the other things. And so the idea was to do a clinical trial that will make yoga-based cardiac rehabilitation acceptable to the Western scientific world. So we started off with reviewing the protocols and the versions of Western-based guidelines. But within that, where there was scope for, let's say, activity, we would introduce yoga, for example, but give the yoga teacher a range of yogic postures to practice from as they see fit. So it's not imposing that you must do in a Western style way only this yogic practice, for example. So it seemed to work for both sides, that there was a system around it that the Western medicine could accept, but there was enough flexibility for the Ayurvedic practitioners to feel comfortable with, that there were rules weren't being violated in the way how they practice. And that seemed to, we did a very large 5,000 people trial. Dr. Ajay was also involved with the same trial across all over India, 20 sites. And we showed that yoga was able to save lives, improve the quality of life. It's now being accepted in many different parts, both in the UK and in India now. So that's one way of explaining what I was trying to achieve. So maybe I think that's...
Yeah. So the last question, which will be common to all of you, is on how the healthcare management education and training in this country should adapt or evolve towards the growing needs of the Ayush industry. Let's hear from the two persons from the industry, but we'll limit to 1 minute each because of the time constraints from you. Yeah.
Well, the education should be properly, thoroughly on the research base only. No more textbook is good, theoretical is good, but one thing I would like to very clearly say, so whenever we again go to the Google doctor, Vata, it says Vata is air, Pitta is bile, Kapha is phlegm. So we should at least avoid the terminology. There is much beyond air, much beyond the bile, and most of the times we try to correlate with the modern terminology. Madhumeha is diabetes, arthritis, Amvata. So the Madhumeha or the diabetes is much more the lifestyle problem. It's not one simple disease. So that the education should be more onto the research base, evidence base. Today everyone is saying science-based Ayurveda. What is the science? There is a lot of science behind every principle. Now, the teachers, the doctors, and the students must understand the science behind every concept. Then they can appreciate the entire beauty of Ayurveda. There is we call it the Chikitsa Sutra in Ayurveda, the line of treatment. Every disease has a line of treatment, and the line of treatment is so scientific. If you understand the line of treatment, then almost half of the treatment is very easy to answer. But unfortunately, what happened is today, most of the Ayurvedic teaching or the doctors also are falling prey to the allopathic system, giving the symptomatic. Jodon ka dard hai, this is the medicine. For this is the medicine. But what is the cause of that Jodon ka dard? So if we are going to the root cause of the treatment, then that will give a lot of advantage for the Ayurvedic studies and for the young doctors.
So looking at what each one of you students here, how it can be incorporated into your protocol, into your curriculum. I would say today morning was very heartened to hear that basic anatomy, physiology you are teaching to the students. Somewhere there is a introductory course, and one of the panelists said encourage that we should bring in little depth. Maybe one course, a small elective called Ayurveda 101, which brings in a perspective on how you look at a whole person. I didn't bring the fact. Apart from integrative medicine, Ayurveda is whole person medicine, and there is this entire category called multi-morbidity, people with more than one medical condition. So today I've got this thing that I tackle arthritis, I tackle this. But when you have to look at a person today, bulk of the people have 3 or 4 or 5 conditions, including impaired quality of life. So when you have to look at that, so these are things which I think will inform them, make them much enriched, number one. Number two, I just want to leave this thought. Whatever you learn as applicable to a modern healthcare facility will apply to an Ayurveda healthcare facility. Same quality standard, slightly different that maybe that surgical, the operation theatre may not be as it's a minor OT in our case, it will be a major OT there, air supply, the kind of radiation therapies. We will not do all of that in a typical Ayurveda center. However, integrative medicine is the future. So I would think it will be good if you bring at least a basic course and also have students to come and intern with some of the leading hospitals, because that will give them a viewpoint and it will place the seed for the future where you can yourself decide how to go.
Okay. Dr. Kintra?
So I think maybe I'll sort of go back to the theme of this conference, which is innovation. And I think innovation doesn't have to mean AI always. In some cases, yes, but not always. I think maybe go away trying to innovate. Innovation can be in how you think about the problem, how you think about today, the whole day you heard about a whole range of different approaches to business, to science, to healthcare. And so the idea has to be trying to, instead of getting boxed down into closed definitions given by other people, think about innovating on how you approach a problem, what kind of a solution you found, and how you even judge whether that solution works or doesn't work. That for me would be the final word for you.
Yeah.
Thank you. Being at NAC A++ institution, AI is a NAC A++, NABH first accredited and ISO certified, but I'm really happy to share to everyone that AI Goa, we have a very beautiful campus and the first commemorative stamp in the first year of establishment was released by our minister on this AI. So I invite everyone to visit this institution as well. With this, other thing is coming to the question is how do we integrate even in the Ayush education, NCIM already has introduced like new education policy. It is more flexible and already NCIM same has electives on AI in all innovative entrepreneurship. So there is a integration and electives already being there. And the similar way the Ayush elective can be there for the healthcare management and the IT and AI so that we understand each other. And the more importantly, there is a learning management system. On LMS, we have what we understand that the knowledge, skill and attitude. The knowledge base can be like disruptive technology, but the values of care, compassion can only be physical in campus only. So there can be a hybrid mode. There can be the telemedicine, and there are many things can be with the technology, with the support of technology, education and training, but hands-on, clinical must be in hospital. So this is the bridge of both, blend of the both that can really serve that for the future. And for the global innovation, I'll just conclude and end my talk that this year Ayurveda Day is being celebrated on 29th October, that is Dhanteras, and the theme which government has chosen is the Ayush innovations for global healthcare, exactly the same. And you are visionary, but be the part of that and celebrate as a global innovation for the healthcare. And we also have the same Aroha international seminar to be organized at All India Institute on 17-18, and that is again on the innovation, entrepreneurship and research. So be the part of that. So thank you one and all.
Yeah.
Our Dean, Dr. Kadam, Dr. Mohan and all are already there. We have our deans and the faculty already there of Goa. So please interact and please do part of that. Thank you.
Yeah, please.
Just one clarification I want to do, because when you look at Ayurveda and healthcare management, the right word to look at Ayurveda, because Durga Prasad talked about Ahar and then he spoke about Aushadha. So the way to really look at Ayurveda, it is as a Chikitsa Sampradaya. Why I use that word so that you don't miss. Chikitsa is healthcare management. So you are actually in one sense learning Chikitsa. And what are the components? Diet, lifestyle, mental counseling, Ahar, Vihar, Vichar, Aushad, Kriya. Now, it's a continuum, and every case, depending on the stage of the disease, you'll have diet, lifestyle anyway, counseling, and then medicine and therapy. All of this comes. So, I would encourage for you to look at Ayurveda as this whole healthcare system where one or more components come in.
So, we will take 2 questions from the students. Yeah.
Hello. Sir, Sarvajit from first year HCM. Sir, now as a, say I'm a consumer and I'm observing what I am buying from the market, and what I see is when it, when it comes to in terms of, what types of treatment I'm availing. So mostly what I feel is that though there's a lot of potential in Ayurveda, yoga and all these things, it is not yet been commercialized, it is not yet been marketed, and it is not yet what I believe, as ma'am mentioned, the theme that government has decided this year, like for the global health perspective, we have not even, like this knowledge, we have not even exported it and given it to other countries where we can generate more business and all these aspects. So any take on that? How can we transform this, and how we can approach to these things?
Just about the Ministry of Ayush has an international cooperation cell, and there are the promotion and market authorization for, schemes are already, this is government answer. But what is the reality is Ayurveda is being popularized in more, is in any form, therapy products or any form in more than 100 countries, and 25 countries it is legally regulated. Maybe we have to have more awareness what is happening at the global level. So we have to be local, but know what is happening at the global level. So maybe, yeah.
Which is called now the new term. So,
yeah. So if you look at it, look at some medical value travel and medical tourism coming to India. So there is some data from Kerala that out of about an estimated 10,000 crores a few years back, 10,000 crores of tourism income, 30% travel of that income is due to Ayurveda based travel. Okay. You look at the number of people who are coming in, that's just the tip of the iceberg, because what is being captured in one sense. But the other part to know, if you look at the reasons why NRIs come to India for healthcare, it is not some advanced thing. It is Ayurveda stands at number 5, this Government of India publication. They're not coming for other healthcare. And who comes to India for healthcare? You'll find the people from poorer countries, developing countries come for healthcare to India, right? But the people from the Western developed countries come to India for Ayurveda medical care. Please don't mistake that. So it's only a matter of time. The rich people, the rich countries, they don't come to India for healthcare, right? So there is a tremendous opportunity. Of course, the point that you say is true. A lot more awareness to be created, and that is what lage raho munna bhai. You have to keep on doing it, and ho jayega ek din.
So to further elaborate to what Dr. Rajiv sir said, from the Dabar's point of view, we are already, and I must say, Ayurveda is accepted in more than 100 countries, and officially it is more than 30 countries. It is legally possible. So with the help of Ministry of Ayush, Dabar is now exporting Ayurvedic products as Ayurvedic products in 150 countries. Yes. And we have our own chain of clinics in 30 countries. We are already there. So Ayurveda is getting popular, but consumer awareness has to be further strengthened up. That is one thing which we are doing, some health camps, at the campaignings, at the shows on the health and the wellness being. So that's the activity which we are doing to further propagate the goodness of Ayurveda.
So, I mean, these kind of things kind of become a part of our life. Say, one person adopting to say one particular treatment therapy in Ayurveda, and then eventually it becomes a part of their lifestyle, and the family also joins. So it is, what I believe is that there is a lot of potential in it, and we haven't explored it. Being is something which is there in our culture itself, we have not done it. So what I believe is that yes, maybe we can together, expand in that perspective as well.
I think supply will create its own demand. You're right. There's a lot of groundswell of positive, favorable opinion towards Ayurveda. Accredited institutions delivering healthcare closer to your home is what will accelerate the whole thing. Telemedicine is opening it up. So today you'll find almost all the online telemedicine platforms are offering Ayurveda. It's a very, very powerful way to reach Ayurveda across the country today and the world. So we are on that track. But thank you for your observations. They're valid.
So due to paucity of time, we need to conclude. I thank all the eminent panelists for coming to GM, and then
just one thing, sir.
Yeah.
Sorry to just take 1 minute only, because now everyone is speaking of the pollution. There are very good solutions given in our Puranas for the air pollution and the water pollution. So there is a Puran called Skanda Puran, one of the Puranas. In Skanda Puran, it's mentioned it mentioned if any person plants one banyan tree, people tree, or 3 apple trees, or 3 mango trees, or 1 neem tree, that person will not see hell. So that's the quotation in Skanda Puran. Hell to chalo theek hai, us time par likha hoga, but what is the meaning? So banyan tree, if the banyan tree ka property hai, it absorbs 100% carbon dioxide. Neem absorbs 74% of the carbon dioxide. Mango tree or apple, it absorbs almost 68% of the carbon dioxide. So these are the plants which were mentioned in Skanda Puran at the time. The scientific logic, now we are evaluating the logic. So if we see that plants, they are actually absorbing the carbon dioxide to give us the good oxygen or good air. So there are many such leads available in our Puranas or Ayurveda, which we must identify, extrapolate, and do the practice into our, bring it to our practice. So that's what I want to just conclude.
Okay. Okay. So with this, we conclude the panel. I thank all the eminent panelists for coming to this conclave and contributing. So over to you, MC.
Thank you to our panelists for an enriching discussion. I'm certain everyone has gained valuable knowledge from this interaction. Now I would like to invite Sean sir to felicitate the panelist. I would request everyone to be on the stage for a group photograph. Thank you, everyone. As we draw this insightful and inspiring session to a close, I would like to take a moment to extend our profound gratitude to everyone present here. Now, I would like to invite Professor Shirupa to kindly deliver the vote of thanks and formally conclude today's event.
Good evening, everyone. I know it's been a very long day, but I'll still take another 10 minutes and hold you back from your tea and snacks. I have a long list of people to thank. It's been a little overwhelming. I'm sure a lot of the students would say that, but extremely exciting. I loved the sense of humor of all the panelists. So many insights. It's been deep, it's been enriching, it's been tricky, challenging, provocative, a lot more. And I think, I'm sure all the students of HCM 1 and 2 have a lot of homework. And I could see Professor Ajay making a lot of notes, so which means a lot of plans coming up, newer plans and surprises. So with that, good evening, everyone. And as we come to the close of this insightful Healthcare Management Conclave, it is my privilege and pleasure to extend a heartfelt vote of thanks on behalf of the organizing committee to all who have contributed to the success of this event. I would first take a moment to express my sincere appreciation to our esteemed director, Professor Ajit Parulekar, for delivering the thought-provoking keynote address that truly set the tone for this conclave. I express heartfelt gratitude to all our distinguished speakers in all the three panels whose invaluable insights, expert knowledge, elevated the discussions and made this event truly enriching. I thank Mr. Giri Athuruluru, President Experience Flow, Dr. Rajiv Singhal, founding member, Managing Director and CEO of Marengo Asia Healthcare, Mr. Dhruv Sukrani, partner, Bain & Company, Mr. Kalyan Sivasailam, founder, 5C Network, Mr. Nakul Jain, Director, Solutions, Wadhwani Institute for Artificial Intelligence from Panel 1, Ms. Amir Shah, Executive Chairperson and Whole-Time Director, Metropolis Healthcare Limited, Mr. Harish Natarajan, Director, HXCO India Private Limited, Mr. Vivek Srivastava, CEO, Healthcare at Home, Mr. Mukul Bagga, Regional Commercial Director, India, Middle East and Africa, Medicom Healthcare, and Dr. Dilip Kumar Chekuri, CEO, Medivalley, Andhra Pradesh MedTech Zone Limited from Panel 2. And of course, Professor Dr. Tanuja Manoj Nasari, Director, All India Institute of Ayurveda, New Delhi and Goa, Dr. Durga Prasad Velidindi, Senior General Manager, Marketing, Dabur India Limited, Mr. Rajiv Vasudevan, Founder and CEO, Apollo Ayurveda Hospitals, and Professor Sanjay Kinara, Professor and Head of the Department of NCD Epidemiology, London School of Hygiene and Tropical Medicine. Thank you, everyone. Your expertise has inspired all of us to think deeply about the future of healthcare and the innovative solutions required to tackle its challenges. Maybe a last round of applause for our stellar speakers. This event wouldn't have been possible for our incredible moderators. I extend a special thanks to Mr. Anjan Bose, our Anjan Da, Professor Arif Raza, and Professor Ajay Vamadevan. You created a platform for meaningful exchange where ideas were not just presented, but explored in depth. With the seamless transitions, thought-provoking questions made each session dynamic and engaging. And of course, I also thank the students who put up those very thought-provoking questions and maybe at times tricky to the panelists. I really liked it. Now I have a whole list of other partners to thank. I start off by thanking Floyd and the branding team who has helped us immensely with our creatives, with all our promotions, with all the billboards that you see. And they've also been disrupting, sometimes taking your interviews. So big round of applause to Floyd and branding. This wouldn't have been possible, the IT so seamlessly working. So thank you, Mr. Mukesh Kumar, who's our Chief Technical Officer, and the entire IT team. Ashley, who's our outbound program manager. Celine, who's our front desk associate, who helped us with accommodation and travel. Serena Vaishnavi, they are our academic associates, and Sienna from the HCM office, who's been managing all queries and all requests. Rajuji from K-Star, who's our hospitality partner. Mr. Dhanesh, Deputy Manager Estate. Mr. Jay Kumar, Senior Technical Manager. Rajiv, who's in charge of accommodation here. Arvind and his team for travel support. Rama and EcoClean, and of course Fortune Miramar for hosting our guests and the networking dinner. I also would like to thank Professor Sumit Datta, Registrar, Controller of Examination, and Professor Venkatesh Naga, Dean Academics, for their support to the conclave. This, of course, this is the biggest part where I come, where is our student volunteers. From HCM first year and second year, over 40 student volunteers have been an integral part of this conclave. A special thank you to our student coordinators and volunteers who've been part of the PR, food, registration, MC, rapporteuring, gift, of course, all our POCs for the speakers. Your relentless effort and behind the scenes work has been commendable. On behalf of the organizing team, I appreciate all your efforts and support towards making this conclave successful. To all our delegates, faculty, and students, thank you for your engagement and active participation throughout the session. Lastly, I would like to thank all my colleagues, Professor Sean, Professor Kea, Professor Nafisa, and of course, colleagues who've been my moderators, who have made this conclave a reality. A lot of brainstorming has happened for us to put this up today. And I can't miss out Anjanda, who's our advisor, for his guidance, support to the entire conclave. Thank you, Anjanda. As we leave here today, I hope the ideas shared will spark new collaborations, inspire innovative solutions, make us think more provocatively, and also maybe question, make us also pause and question, drive all of us to contribute to a more efficient, equitable, and sustainable healthcare system. Safe travels, and see you in the next conclave. The snack waits outside for you. Thank you so much.